I'd like to call the Ramsey County Budget Committee of the Whole to order. And today we have a full day of health and wellness, a huge part of our budget, and something that we're really looking forward to as far as how we will be really working to improve the lives of the people in Ramsey County. So I will start out with just the regular budget chair remarks so that everyone that is listening to this for the first time will hear the information. And for others, you never know what I might say. So the county manager presented his budget for 2020-2021 budget to the Ramsey County Board on August 6th, as we all know. He proposed, the proposed budget called for a 4.75% levy increase in 2020 and a 4.75 and 4.5 levy increase in 2021. The budget itself for 2020 is $741.7 million and $763.4 million in 2021. This represents, and I think this is important, a 0.5% increase in the budget in 2020 and 2.9% budget increase in 2021. And what those numbers tell you is that it's not even keeping up with inflation as far as our spending, but how we're spending it is different. And where the money is coming from, particularly intergovernmental transfers from the state of Minnesota. More mandates, less money. That's kind of the mantra there. Budget hearings on the county manager's proposal began 2 weeks ago, right after the man, time is flying, and I cannot believe that we're already in the latter part of August. Anyhow, and they do run through next, well, I guess it's this week, August 29th. At these meetings, the board will review and discuss spending recommendations for each department and service team. As I said, today is the Health and Wellness Service team. The detailed budget, for those who would like to get a little bit more into it, is for both the budget hearing schedule and for the budget itself. You can go in, is www.ramseycounty, all one word, .us/budget. The first public hearing to be held on this budget is on Thursday, this Thursday, August 29th at 10:30, right here in the courthouse. If you'd like to speak to the board, you can sign up with the clerk of the board at www.ramseycounty.us/chief clerk, or you can sign up at the meeting. And basically what it comes down to, we go in the order that people have signed up in, so you may want to sign up ahead of time, or you can do so by contacting the chief clerk. The second public hearing will be held on Monday, November 25th at 6:30 p.m. at the Maplewood Library located at 3025 South Lawn Drive. And again, for either or both public hearings, you can sign up ahead of time. The budget hearing agenda. At the start of each budget hearing, the assigned deputy county manager for the service team will provide an overview of the services provided within that service team, and today that is Dr. Paul Allwood. There will also be a review of the major initiatives and changes proposed in the budget. Department directors will present more details for the specific department budgets. After the presentation, I'll open the floor for questions and discussion. Now for the agenda, or the schedule moving forward. All budget administrative addenda and changes will be introduced and voted on at the August 29th budget meeting. Commissioners' addenda, if there are any, will be heard on Tuesday, November 26th. The final adoption of the budget by the board will occur on Tuesday, December 17th. And just wanted to note that this afternoon's budget schedule will be held in room 220 in the courthouse, which is one floor down from here. And again, it will be on the health and wellness. And I think that covers the opening comments. So I will now turn it over to Dr. Allwood.
Thank you, Madam Chair. Good morning.
Good morning.
To members of the board. Good morning to everyone that's here. Um, it's a real privilege for me to present the Health and Wellness Service Team's budget to the board. I've used the comment that, HWST, which is the abbreviated form of Health and Wellness Service Team, could also mean the hardest working service team. And people have not always liked that. So I'm going to change that slightly and say it's the hard working service team. And, I really believe that very sincerely. And as evidenced by the attendance here this morning from the service team, I think these are words that are pretty true. So I want to thank the members of the service team that are here, the department heads and others who have joined us for the presentation, for all of your hard work helping to put this budget together. I also want to thank the county manager and the county manager's budget team for a lot of useful and very, very helpful advice as we worked on putting the budget together over the last several months. Just to kind of orient members of the board, the service team's overview pages are page 16 to 19 in your budget book. And the major changes that impact the service team can be found on page 44. And our main budget content will start on page 262. So when the county manager gave his budget presentation a little while ago, he made a comment which I thought was very resonant and relevant. It essentially is that our budget is a concrete demonstration of the county's priorities in action. You'll see as we present the Health and Wellness Service Team budget that the budget positions Ramsey County, as the county manager said, as an organization of excellence, and one that other local government agencies will want to emulate. So I hope you will be able to recognize and acknowledge that as you hear from the service team today. The Health and Wellness Service Team is made up of the following departments: public health, social services, community corrections, health and wellness administration, financial assistance services, veteran services, healthcare services, and within that there is Lake Owasso residents and Ramsey County Care Center. As Madam Chair mentioned, each department will give a presentation that will go in depth into the work that's done within their department. And I hope you will, and not hope, you will hear that the vast amount of the work that's done in the Health and Wellness Service Team is forward-facing, providing direct services to the residents of Ramsey County. Sort of in follow-up to the county manager's presentation, this budget, the Health and Wellness Service Team budget, will also reflect our full commitment to the county's race equity work, and the goal there being that we can be consistent and meaningful in the way that we advance race equity across the county. The Health and Wellness Service Team is partnering with other service teams and other departments within the county to achieve a set of strategic goals. The first of which is that in partnership with the community and by integrating work across Ramsey County and revamping traditional models of service delivery, the Health and Wellness Service Team will help transform health, well-being, and justice systems to achieve better outcomes. We're doing this as part of the initiative that's known as Transforming Systems Together. And our contribution to that initiative is reallocation of $1 million that were previously targeted towards integrated health and justice and alternatives to placement efforts that's now taking place within the Health and Wellness Service Team and will now become part of the Transforming Systems Together effort. We're also transferring 2 FTEs from health and wellness to the county manager's office to support this initiative. The work of transforming systems will integrate and strengthen important efforts at the intersection of mental health and the juvenile justice systems. The service team is also working with EGCI and IPR on the Residents First strategic priority. I am working in very close collaboration with my co-executive sponsors, DCMs Karen Francois and Joanna Berg, in doing work to create a resident-centered organization that delivers effective and efficient services that meet and exceed the expectations of community and that are accessible, welcoming, and efficient from the perspective of the resident. We will be taking a holistic approach to this work that will begin with approaching residents and employees for quantitative and qualitative feedback that will advise our decision making. The service teams also had the opportunity in this budget to reform their budgets and reallocate resources to achieve strategic outcomes within the service teams. The Health and Wellness Service Team reallocated resources for 4 key priorities that have countywide impact and that directly relate to Ramsey County's strategic priorities. And these you can find on page 44. The first of these 4 is justice reform to reduce incarceration and out-of-home displacement and serve people where they live. This is an initiative that's being carried out by the Department of Community Corrections, and we've invested $2.5 million per year in this investment. And when you hear from the Director of Community Corrections, Mr. Clavens, later on, you'll hear some more details about what's happening and what's planned with that initiative. We are also investing, the Public Health Department is investing, or the service team is investing reallocated monies to the Public Health Department to the tune of $310,000 per year to implement a strategy to reduce gun violence in our community. Kathy Hedin, our interim Public Health Director, will elaborate on this initiative when she gives her presentation. Our third strategic initiative is called Advancing a Holistic Approach to Strengthen Youth and Families Through Child Welfare System Reset. In the next biennium, or in the upcoming biennium, the Health and Wellness Service Team will address significant racial disparities that exist in every layer of our child welfare system. To achieve this, we will be investing about $1 million a year in reforms that will help ensure that we address this pernicious and almost intractable disparity that we experience in our child welfare system. Ann Barry, our interim social services director, will elaborate on this during her presentation of the social services department's budget. The final strategic initiative for the service team is called Optimizing Key Housing Functions to Place Residents First and Support Housing Stability. As all of you know, the impact of homelessness is felt throughout the community, and work to address it takes place in various parts of the county, in various departments and programs. We are investing $1.1 million per year in an initiative that is looking to the future and doing work that will ensure better coordination and better optimization of the services that we provide to help ensure housing stability and to help end homelessness in the county. We have taken initial steps in implementing some of this work. For example, we recently hired an interim housing stability program manager using 2019 dollars to start work on creating the optimized structure that will help to achieve the goals of this initiative. Carol Rylander, who is stepping up in the absence of Tina Curry to present the financial assistance services budget, will go into more details about this initiative. Overall, the Health and Wellness Service Team is decreasing positions by 7.2 FTE in the new budget. This is the result of positions transferring and yes, this is as a result of positions transferring, including a couple important things that happened during the last budget period, where a cost shift from the state resulted in about 18 FTEs being reduced from the Department of Social Services, and the addition of about 5 FTEs in public health. That's not the sum total of the reason for this, this net negative or net reduction of 7.2 FTEs, but these are a couple of important things that led to where we are. The increase to levy is 2.5% in 20 and 1.1% in 2021. There are the major changes that have occurred in the Health and Wellness Service team, and the department heads will discuss the ones that I have not talked about here. And also, at the end of my presentation, the Deputy Financial Officer will also discuss some of the major changes in the service team. I'd like to turn now to the work that we're doing in community engagement and race equity. In the next biennium, the Health and Wellness Service team will take advantage of momentum that's already building across the county to improve race, equity, and community engagement in the work that we do. Some of this will include making adjustments in how we provide service and including communities, especially communities that have been most adversely impacted by structural inequities and that have typically not been at the table or not been involved in the discussions and the decisions that impact them. We will continue to hold outreach events, such as was done for the Community Health Needs Assessment by the Department of Public Health, such as Financial Assistance Services lobby pop-up events, such as Health and Wellness Administration's new vendor information sessions, as a way to ensure that we are not only getting communities to provide input, but that we are empowering communities to be full partners with us in helping us reach good decisions that will impact communities in a positive way. The community will continue to play a very important leadership roles in the work that we do in Juvenile Detention Alternatives Initiative and in the governance of the Transforming Systems Together strategic priority. There is also other existing resident advisory groups that will continue to perform very important service on behalf of all of us in this community. This is something that we value and will continue to support, to the extent possible. In addition to community engagement, through meaningful inclusion of diverse voices in service team efforts, the departments are building capacity to do race equity work And we're changing policies and procedures that have had disparate impacts on communities of color. Some examples of this work include using root cause analysis and decision point analysis to make changes in child welfare policies, such as moving to race-blind screening and removals. Another example, eliminating or decreasing fees associated with probation and incarceration. Also providing additional support and training to small vendors, many of whom are organizations owned or managed by people of color or immigrants. We're also changing hiring and promotion policies to encourage attraction and retention of staff of color. In conclusion, the Health and Wellness Service Team's 2020-2021 budget demonstrates ongoing leadership and progress that is being made to ensure that Ramsey County is a county of excellence, working to enhance our quality of life through our goals of well-being, prosperity, opportunity, and accountability. Thank you for taking time to listen to me, and I'd be happy to take questions now or later.
I think generally we would probably, as the questions come up, would be asking questions, but if anyone has a comment right now. Commissioner McDonough?
I have a comment, and I'll have questions as the directors come up, but and we've seen this in previous service teams, but I just wanted to make sure we took a moment to call this out on the major changes. Once we did the reorganization into service teams and we started seeing this movement to actually integrating the work we do, and I look out in the audience and I see all the departments represented here and being a part of this budget presentation, but this sheet here at major changes really highlights the work that's gone on in this service team, but I think in all of them, of how we're working together to support initiatives within the service team, moving money around, moving employees around where we need them at that point in time. And I just wanted to take a moment to call that out, because sometimes we miss some of the big things. There's a lot of stuff on this major changes sheet here about how we're responding to needs and gaps in our community. And I think this is a really good example of our folks coming together, working together, and supporting each other as we do this work in the community.
Thank you. And actually, I think I'll make a few comments here as well. There's been a lot of attention paid to the transforming systems together. And I think as we go through today, I hope that everyone that is listening and is part of this, that transforming systems together is so important, and the health and wellness team, service team, is really at the core of that. But the entire county, every person, every employee, every contractor is involved in it as well. And so I just want to, as we're listening to the departments, and I know we're going to get to the major changes as well, to me it's really important because, people have questioned, well, why is this important? And yes, we have reallocated, we have moved things around a little bit, and to make sure that we can really address this. And one of the things that I have said to folks is, if you think, there are disparities, that's all there is to it. And all you have to do is look at the justice system. The Juvenile Detention Alternatives Initiative has been incredibly successful in not having as many children incarcerated. It's down by 50%, and primarily because of the alternatives, the JDAI that we're working on. But the percentage of children in our justice system has not changed. And it is very the disparities are just shocking, and as people are looking forward. And the fact of the matter is, it doesn't matter if you're in the justice system or not, we're all impacted by it. Every single person who lives and works in Ramsey County. We look at child welfare and the disparities there and the families. out-of-home placement, mental health services, all of the other services that are provided through that. Again, when one person, when our neighbor or someone in the next community is impacted by it, we are all impacted by it and how we work in our and live in our daily lives. Housing and homelessness. You know, it is so obvious that there are disparities there when you look at the home ownership rates, the rental rates, the percentage of people that are homeless, and the disparities that are there. And we all know, and that, in fact, there's scientific study on it that says for housing, when you have mixed income housing, everybody that lives there is healthier. Doesn't matter what your income is. Everybody, the highest income to the lowest income, everybody is healthier. And there's data that shows that. So we are all impacted by that as well. And I probably will say this at the beginning, the middle, and the end as well. The fact of the matter is, as Senator Wellstone said, when we all do better, we all do better. And that's what this is about. This is about changing systems that have been in place for way too long so that we got comfortable with them and thought that's just the way it is. But we are not settling for that here in Ramsey County. We must make changes so that we all can do better. Commissioner McGuire.
Well, we're calling out amazing things that you're working on and transforming. I just want to recognize the great work that we are very, very much more deliberate on, which is the early childhood initiative, and just starting early, the prenatal to 3 work that we're doing, the work making sure that it's system-wide and how we're working with our children and families. And I'm just really proud of the fact that our county is really looking at how we are transforming those systems. So we're starting earlier and really helping our families and children as soon as possible. So thank you for that and for your whole team's efforts in that.
Okay, we will move forward then to Deshani. You're going to go over the major changes, and that's on page 44.
Madam Chair, Commissioners, in addition to the priorities Deputy County Manager Allwood outlined, I will highlight some of the major budget changes in the Health and Wellness Service Team 2020-2021 budget. This budget makes up approximately half of the total county budget. Proposed budget reflects a net staff decrease of 7 FTEs in 2020. Main reason for this reduction is due to the loss of revenue from MinChoices. Again, the information I'm referencing can be found on page 44. Throughout the day, department directors will provide more details on these changes. As Dr. Allwood mentioned, Health and Wellness Service Team transferred $1 million and 2 FTEs to the county manager's budget for countywide initiative Transforming Systems Together. Community Corrections Department budget includes a reallocation of $2.5 million each year for criminal justice reforms and resident-centered services as a result of closing Boys Totem Town, BTT. Public health budget increased by $5.3 million each year as a result of correctional health program being moved under Public Health Department. Public Health Department also increased FTEs by 5 to add nutrition health educators as well as a program analyst. Public health budget also includes reallocated funding of $310,000 to implement an initiative to reduce gun violence. Solid Waste Fund will continue to support the 4R program in PTRES, Property Tax Record Election Services, by allocating $310,000 each year. Social Services Department has reallocated $1 million in funds to redesign child welfare system. Again, 17 FTEs were reduced due to the loss of MinChoices revenue. Financial Assistance Department reallocated $1.1 million each year for optimizing housing stability. And that concludes the major changes for Health and Wellness Service Team 2020-2021 budget.
And again, I do think it's important to note when I started the budget hearing today that the loss of revenue from the state really does have a huge impact. And so when you look at the what we have tried to do and the amount of money that has been reduced, I mean, $2 million was reduced, but the mandates did not go away, and the work did not go away. County Manager O'Connor, and then Commissioner Carter.
Thank you, Madam Chair. Members, I did want to mention on number 9, the social services min-choice reduction, because in part, this happened right before the transition to Paul being here as well as the deputy. And so it's a good look back to our workshop. We had the workshops talking about the impact locally to the budget balancing tool the state used in the previous biennium. This is where it hits home, where we have finally removed the existing FTEs from the budget because we don't see funding on the horizon for them right now. And so this is really that true up in many ways. The funding had gone away. We'd stepped down the complement to manage within staff, but now the positions fall off. And so as you do the math for the service team, I think that matters on a big level. This was a conversation that came up twice during the budget meetings with staff as well. I mean, I will highlight, this is not something just at this table we're talking about it. It's felt on the ground. Our wait lists have expanded. Social services can talk about that more when they get here, and they're doing a lot of creative stuff. Keith and I actually had a moment where we ran into each other and talked about this recently. But this is a spot where I continue to say, if the money comes back and the state follows through on the vision they initially put in, this would be an immediate transfusion back to be able to help support staff in an area where we see untenable wait lists and for some of our most vulnerable. And I just wanted to call that out. It continues to be a troubling spot for us.
Commissioner Carter.
Thank you. I just, noting that this comment has been made in different ways, just would like to underscore once again the transforming systems together work, and the fact that this page 44, that we're looking at under Health and Wellness Service Team major changes, is a plethora, quite frankly, mostly of reallocations that really do focus on moving us from deep end toward prevention and changing the manner in which these systems work, as Commissioner Reinhardt has already stated, so that they work better for people, but also making certain that we're working earlier in order to get to the concerns that typically drive us to less productive use of funds when we're addressing the deep end needs of out-of-home placement or corrections or even gun violence. So the majority of these changes do reflect our movement from deep end to prevention. And again, thank you. That is not only in the health and wellness budget, it will be in others as well, as we see.
Okay, thank you. We will move on then to social services. Good morning, Ann.
Good morning, Madam Chair and board members. My name is Ann Berry, and I'm serving as the interim Social Services Director. I've been acting in this position for about 2 months, so I'm still learning every single day. And I want to thank and recognize 3 of the division directors who've helped me over the course of these 2 months. First of all, Bill Kalmbacher, Keith Lattimore, and Kim Clemenson, and the newest member of our leadership team, Jen Nance, who joined us today as my administrative assistant. So thank you to all of you. I start on page 310 of the budget book, so jump ahead just a bit.
Thank you.
I'll also be referring back to pages 18 and 44 that both Deputy County Manager Allwood and Dushani have presented to you. As the Social Services Department for Ramsey County, we do put people first. We're responsible for helping people, families, communities of Ramsey County to thrive, but in some cases to survive. We are the local authority for a number of services at the county level, for child protection services, for mental health services. Child protection, I already said, and adult protection. And finally, for chemical health services. Those are the places where the state relies upon us to be the local service delivery and the local authority. I have to remind myself, and I guess everybody else, that it's 2019. The Social Services Department was created in 2016 with the separation of what was then Community Health Services. And over time, we continue to make organizational adjustments. So you will see that in the next 2 pages as I present the changes that are taking place. In addition to budget reallocations, there's also been staffing adjustments and changes. Our work is challenging, and it's challenging because not only are we dealing with a population that is aging, but is continually diversifying, and the increase in persons and families who have complex needs. On the bottom of page 310, you'll see our organizational chart that we currently are acting under in 2019. I would note that the big change here in 2019 was that earlier in this year, the adult services, the 2 adult services boxes were actually one division. And former director Womasetta Jones came to the board to ask for the separation and the creation of a new director position to really begin to streamline more of the work and balance out the work in one of, I think, the largest department in Ramsey County. You can also see then when we move over to 2020 that we have some reductions in staff, but I want to explain some of those reductions and changes. So in the Adult Services Division, you'll see we went from 191 staff to 151 staff. We moved staff over to Child Protection or Child and Family Services for crisis services. We also moved staff who did adult foster care licensing, and we moved accounting staff and billing staff in our mental health center to the Health and Wellness Administration Division. So what looks like a rather substantial reduction of 40 staff is mostly a reallocation to other places. So that accounts for the big change there. In adult services, we've already talked about min choices, the biggest reduction there being almost 18 staff that were reduced, and County Manager Ryan O'Connor already explained that, I think, very well. 2 other small changes. We took 1 staff from that area and moved it to our detoxification center, and 1 staff was moved to Children's Services. And then finally, in the Children and Family Services area, you see an increase of almost 30 staff. We moved crisis staff. We made a strategic reallocation for the child welfare reset that we've been talking about, and then adult foster care licensing staff was added there. You can see listed on the bottom of page 311 are the people we serve. I don't need to read that list to you. They're very familiar to you. We serve people of all ages across many programs in the county, and we provide many different kinds of services, which I'll talk about as I talk about some of the changes taking place in social services. Let me talk about community engagement activities and some of our racial equity activities taking place in social services. I think we work from a place where community doesn't always trust the work that we do in social services. We have both voluntary and involuntary program, which makes for a really interesting mix in how people see the work in social services. So on the child protection side, we're seen as people who remove children, who displace children. But on our min choices side, we are seen as a provider of, or the gatekeepers for assessments and reassessments for services to people living in their homes. So we have this very mixed kind of personality in social services, and so people see us very differently. We also know that some of the work we do has created real disparities in outcomes for children and families in our communities. You've all spoken to that already this morning. I would just echo that. We are working with the community to get input from those who are impacted by our child welfare system. We're using a consultant, Bobby Simpson, who is of the community and has been working in the community to listen to people who have been impacted by the child welfare system to get a better understanding of what it is that we do to create these disparities in communities. We also rely heavily on the community advisory councils, and then in addition to that, we added 2 councils over the last year, one specifically addressing the needs of youth. So we've actually, young people who have been in our programs are advising us about the impact it had on them while in our programs. And Deputy County Manager Allwood already talked a little bit about the blind screening and blind removal work that we'll be doing. What we will do with children in the child protection system, we'll do the intake work, and then at that point in time, there'll be a pilot so that a small group of people will be randomly taken out of that assessment process. And alongside community, we will look specifically at the decision that was made, whether to intake that child or not. What we'll do in those cases is we are blind to a lot of information, address, name, zip codes, and while doing that, what we're looking for is what kind of bias there is in our systems that sometimes we are unaware of. Mm-hmm. Other states, other counties have done this with success. We want to take a look, and to do so, we want to do so with community in our work. So those are some of the examples of actually engaging community by listening to them, but I think more importantly, engaging them in the real work, right? In the work that we do on a day-to-day basis. Both are really very important parts of our engagement with the people we serve. And for advancing racial equity in our budget process, I think that in addition to our membership as part of the entire racial equity action team for the Health and Wellness Service team, we've created our own supporting racial equity action team inside of social services so that we can begin to work not only across our department, but across the entire Health and Wellness Service team, hopefully across the entire county, to begin to understand and deconstruct the work we do so we begin to understand where there are inequities and unfairness in results. I say this a lot. I think many of us can deconstruct the work. I've spent my career in government. That doesn't mean I can reconstruct it. It doesn't mean that I'm the one who has been impacted by the results and the harm that's been done to people, but by engaging community, we can actually change that direction. Well, also, I already talked about the blind screenings and removal. I mean, I think this is a real good opportunity for us to work directly with community that's been impacted, and then very specifically in the child protection arena, we're talking about American Indian families and children and African American families and children. Challenges, I've moved on to page 313. Challenges, we have a number of challenges like everybody else does in this budget. The Child Protection Task Force from 2015 really did change the direction of child protection across all of Minnesota, but it particularly impacted us here in Ramsey County in a way that I think we knew was going to happen, but almost impossible to prepare for. What we saw was the growing disproportionality and impact, again, on American Indian children and families and African American children and family. Deputy County Manager Allwood used the word displacement, and that's what we do. We remove children from their families and we displace them. One of the things that's become very important and very clear is with the reset is we need to think about our vision. What is our vision? Well, our vision is children belong with their families, and families are the natural child protection system in our community and across this country. To do so, we need to do everything we can to move upstream, support those families early so that we don't all find ourselves in the deep end. We also need to look at our processes, whether it's intake, screening, what happens once we move through the court system to adjudication. All of those things need to be looked at. So I think our biggest challenge will be that we also have state law to contend with, right? So understanding the room we have within state statute to make changes at the local level is a really important part of our work. The second major challenge we face is the legislative action in 2017 that reduced the MnChoice's budget. I'm not optimistic, well, of a couple of things, but one is that we will get all of that funding back, but the second thing that is equally discouraging to me is that the system we were going to use to support and redo choices probably won't be up and running at least for 2 years. Priorities that come before min choices at the state level will be the MMIS system, the Medicaid Management Information System, and the Social Services System, both which need updating and are more than 30 and 40 years old. But we had to make some choices, and what is happening with those choices is we prioritized reassessments over initial assessments. What that means is anybody who's on the program will do the reassessment because we don't want somebody to drop off a program when they're living in the community. But what that does is it means our wait times for people who are seeking initial assessments, and these are people living with disabilities, physical disabilities, intellectual disabilities, people who are elderly. The initial assessment into our program is now about 3 to 4 weeks. Now, our division director, Keith Lattimore, has been working creatively to, whether it's using overtime, temporary employees, working with the Department of Human Services around how much time it takes to do a reassessment, any number of ways that we can make shifts in this budget. But it still means we have wait times for people who are waiting to get onto these programs. And the last is we don't know where the Olmsted-Jensen settlement is going at the statewide level. At the district judicial level, it's the court didn't end the settlement agreement, so it is still active and strong. And the question is, what does that mean for Ramsey County and people living with intellectual disabilities in Ramsey County? Opportunities, there are those as well. We are the first county in the state who is certified by the Human Rights Campaign as a leader in supporting LGBTQ youth to live in families in our foster care system. We're proud of that work. The next thing is, again, the changes that we believe we can make by resetting our child welfare system. We really do believe that we can see reductions in the number of children who are removed from their families and providing greater support for family and communities. Another opportunity that's not listed here, but is the Family First program. This is coming from the federal government. The Title IV-E foster care money is now can be used for upstream preventive services. So many of us are involved in working with the Department of Human Services to make those adjustments so that money that's currently being spent in the foster care system on deep end services like displacement could now be used upstream. And this is where some really good work I think is happening between corrections, public health, and social services to look at ways that we can move upstream to support children and families before they are deep into our systems. On to page 314, I've already talked a little bit about the Olmsted plan. The Mental Health Center received a grant to become a certified community behavioral health clinic. We have a little stress there. We're working to make sure we meet all the requirements, but in doing so, it's new revenue to the county, to the Health and Wellness Service team. And the reason for doing this is that we want to bring together a person's mental health services alongside their physical health services. What we know is people who live with mental health services also have many chronic conditions that complicate their mental health illness. And so we really need to be treating and addressing both mental health and physical health services at the same time. And then the last item I'll say, not listed here, there were legislative changes last session in the Consolidated Chemical Dependency Treatment Fund. The state finally, after many years, or the legislature, I should say, after many, many years, has dropped the county responsibility into the Consolidated Chemical Dependency Treatment Fund, which means money back to the county. There was an error made in the revisor's office, if I understand what happened in the process, so that won't happen until 2020, but it still means that that share that we had, which is I think almost maybe $1.5, $2 million, somewhere between $1.5 and $2 million, we will no longer have to pay to the state to be a part of that fund, yet we can still be beneficiaries of the Consolidated Treatment Fund. And also, with some Medicaid rule changes, we will now be able to bill for some of our services. We'll be able to bill for detox, but when we provide chemical dependency treatment services in our in what we call our detox center, but they will be separate services, we may be able to start billing Medicaid for those services, which would, again, be new money. So there are some opportunities in this budget as well. The last 2 pages are the performance measures that we are using. I'm not going to go through each of them. I will finish then by taking a look overall at our budget. You will see that for the most part, the budget for 20 and 21, I would say it is less than in 2019, but if you put together the 2 years, it's relatively flat. That there's been some reallocations of resources, but not a lot of bumpy changes for us to have to deal with. The biggest one, of course, it has been difficult, is the reduction of about $2 million in the Min Choices program. But other than that, not a lot of changes overall. That's all.
Thank you. I would like to go back a little bit on 2 of the things to highlight them. I mean, there's a lot to be highlighted here, obviously. But I think that, when we talk about the shift in state funding and the impact that it has on individuals, when you talked about the assessment, the intake process, it used to take 3 to 5 days, is now 3 to 4 weeks, if I remember correctly. That's a direct result of legislative action. And we still have to do the work, but since the funds were cut, it takes longer. And some people may say, well, that's okay that it takes longer. But the reality is the people that are coming in for this are seniors and people with disabilities are in crisis. 3 to 5 days is like a lifetime when you are in crisis. And yeah, there are real impacts to the decisions that are made, even though it doesn't seem obvious as, the $2 million cut here or there at the state level really does have an impact on people's lives and, as I think you talked about, actual survival. What do you do? But the other thing that I know is going to be a constant theme here today is upstream. And moving things upstream. And again, for those that are listening to this, it really, as Commissioner Carter said, it's about moving from the deep end services, which are very costly, to the prevention services. Not only is it less expensive, but the outcomes are much better for society, less crime, less poverty, less people on the streets, all of the things that we're working so hard on. And so when we talk about upstream, it's really about improving the quality of lives for everyone, especially those in crisis, but also saving money. The issue here, of course, is that it takes time you can't just stop the deep end services to put them into prevention, put the dollars into prevention. And that's the phase that we are really in right now when we're looking at transforming systems together. And I do happen to know this firsthand since my dissertation on taxpayer costs avoided to preventing crime. The cost in dollars is real. The cost in lives is real. Moving things upstream into prevention improves everyone's life. But again, it's kind of this esoteric thing that's out there when we talk about deep end versus the prevention side of things or upstream. So, but as people are listening, when they hear that, that's really what it's about. Okay, other questions? Commissioner Carter.
As I look at the budget pages, I note on 318, 19, 22, and 24, you don't have to flip to all of those, but there are numbers for out-of-home placement, and you indicated the savings that are being booked in out-of-home placement. I have a question about, this is old, but 2019 and your thoughts for how that comes in, budgeted amount or over budgeted amount for out-of-home placement in general. And as you look forward in 2020 and 2021, I do see a reduction from 2020 to 2021, but I wonder how that reflects against the 2019 budget. And if this includes all of out-of-home placement, or if it is specifically out-of-home placement for child protection. You know, we also have mental health and, of course, the general.
Madam Chair, and Commissioner, so the way I understand this level of detail is that it's out-of-home, it's what we call displacement or out-of-home placement for all of, you know, it's the entire budget, right, for child protection. And people are nodding their heads and affirming. But we have freedom within that line item to move money around to different kinds of services. So for example, right now, when I first came on board, probably the second week, I was signing a contract with a provider that had services in Iowa, Florida, Georgia, and we were paying $600 to $650 a day to send children out of our state, along with a requirement that families be with their children. So we would be sending families and workers and others out of state, and I know we can do it smarter. We all know we can do that smarter. So we've begun the process of looking for culturally specific services that we can build in Ramsey County, and providers who want to work directly with us here in Ramsey County. So some of these things we can do inside of our own out-of-home placement budget. So it's movement within that budget that's taking place. Does that get at your question?
It gets at it. May I just push a little further?
I'll see how far I can go, but sure.
So the intent of the question is that we have seen, you know, as we've worked through the Child Protection Task Force recommendations, knowingly the increase in out-of-home placement, displacement, thank you, and specifically the growing disparities over the years. And we at this board have stomached the fact that that increasing displacement required increasing resources. If I look at the budget from 2019, the actual amount of that budget for displacement on page 318 is less than in 2020. And I am asking the question, is that a reduction based on the actual expected expenditure from 19 to 2020, or is that an actual increase in 2020 that then moves to a decrease in 2021?
Madam Chair and Commissioner, it is a combination of things. It's a reduction based upon an expectation that we will move upstream and start to provide, you know, that we'll have less children in our service delivery system. So that's one thing that accounts for the reallocation. It's also a movement of some resources to provide other kinds of service delivery that you'd see in other parts of the budget. But we're heavily relying on changes in the program to reduce the number of children that make their way into our system, which is our goal.
I applaud those changes, and I know that you will be assessing the success in that goal, not only in terms of numbers, but also in terms of whether we have that body of resources more locally developed that can work with us in this regard. Right now, I am actually asking about that number from 2019 to 2020, and I'd like to hear how that's derived. Thank you.
County Manager O'Connor.
Madam Chair, Commissioner Carter, members, and so first of all, there is no scientific way by which we calculate the out-of-home placement budget. Janelle is saying, yeah, that's kind of how it goes. And a lot of it's been very reactive. I think a good grounding that we don't see here is we were somewhere near 10 or 12 million only a number of budget cycles ago. And so this is one of the largest, if not the largest area of growth in the county budget over the last 8 years. And I think it's important to start by grounding there. So you can see our actual from 2018 was 20.3 million was our spend. I do not have what our 2018 budgeted amount is in front of me. I guarantee you it was less than 20, and it was probably somewhere in the 17 or 18 million range. Janelle is saying yes. So the FY 2019 budgeted amount is likely similar to what it was budgeted in 2018. We will likely come in over that amount. 2019 attempts to bring it up, but not all the way into the $20 million range. And then you see us start to try and bend the curve beginning in 2021, ticking it back down. I will highlight that on the trajectory we have been on for the last years, this is the largest bet we make in this budget on the idea that reform work can bend a cost curve. Absent changes to our system, absent more successful interventions that don't require $600 a day out-of-state placements, we will blow that number out of the water and be using the rest of our health and wellness service team budget in Ramsey County to have to backfill it. The belief we made that I think is important to end on is to say, but if we simply fund the increase, we remove the incentive for us to make the change that we seek to make. Final thing to you, on page 415 in your book, Community Corrections, for when you go there later, that's where juvenile probation is listed.
Right.
And so it's a combination of that number from page 415 on juvenile probation plus this number if you wanted to add together the county's total placement budget, which pushes another $10 million on top of what you're seeing on page 318.
Thank you.
Thank you. Commissioner McDonough and then Commissioner Modis Castillo.
Thanks, Madam Chair. I just wanted to make a couple of quick comments, and I have confidence that you and your team really understand this, but the 19 years I've been sitting up here and going through budgets and policy, and I've watched this pendulum in child protection, and there's times when we just, minimize our risk and we just take every child that comes in out, and then we go over here and then we keep, and there's no science here, but really the work we're trying to do. I appreciate the blind study to really recognize and all the efforts that we're ensuring that if we do have to take a child out of the home, there's that justification and understanding of why. Building that trust in the community about those decisions is going to be really important. So I also wanted to talk about this piece right here because we do have that responsibility to kids in our community to keep them safe. And those are some of the toughest decisions. And over the years, folks have asked me, what is the most impactful thing that you've been able to do? And as a county commissioner, what means the most to you? And there's so much, but I always share this call I got one morning from a grandma who was just in tears, who for months had been working with her daughter to try to ensure her grandbabies were safe and continued to work with family. And it just got to the point where, her own assessment is those grandbabies were at risk and the daughter was not working with her. So she is the one that actually called child protection, to intervene with her daughter and her grandbabies to get them safe. And where the rub came, or where the issue came, is, she said, yesterday child protection came in, they took my grandbabies out of the home. Thank God, I know that we were a part of that, and we really needed that to happen. But then the wall went up, and she needed those grandbabies in her home to give them hugs and loves because of the trauma, all the trauma of the issues about being in an unsafe environment, but that trauma of being removed from their mother no matter what is huge. And that wall went up immediately, and she was just totally frustrated because she needed to get those grandbabies into her home and to keep them safe. And so I don't want to lose sight here about the continuum and the spectrum about our response and how quickly we are responding to ensure that if we do make those decisions and they're warranted to be able to move kids out of the home, that we are, really focused in on trying to ensure that these kids have the love and support in the least, struggling for the right word here, right? But that doesn't compound and bring more trauma to their lives.
Madam Chair, if I can just respond, I know there wasn't a question, there was a comment, but Commissioner McDonough, I would like to say that, yes, we do put walls and barriers in place to families, and the first thing we should do is look to the GOMA to be supported as the caregiver. And I might add, we could go even further, which is we can't use state resources to do this, but we could provide services to both the mother and the grandmother to support those children in one place. I mean, I don't know where the issues were in this situation. Right. I don't know if they were substance abuse or mental health issues or whatever they were, but we don't have to do this the way we do it. And we can look for family first. The other thing we'll find sometimes is that we want to place with a relative or somebody else, and then we do the background study and find that there's something that interferes. Well, I would like us to take on state statute or work with the Department of Human Services to find ways to do set-asides and variances, because you are right, the trauma from being removed from a parent is enormous, but to be removed from an entire family is equally problematic. So those are things that you know, we carry with us every day with the work that we do, and so we will look to family members, and maybe it'll cost us a little more because we're going to use all county dollars, but it's the right thing to do, and over the long term, it is less expensive than a long-term displacement from the family.
Good.
Thank you.
Thank you.
Commissioner Menace Castillo.
Madam Chair, first of all, I just want to say thank you to your team. I know it is incredibly hard work. Nobody comes to the county on their best days. And so when they're coming to your department, they're coming in crisis, they're coming in need, and that takes a tremendous toll on our employees. And so my question is about our employees. You know, we've talked about the cuts from MinChoices 2 years ago, and we continue to feel that incredible strain, and the workloads are rising, as well as the wait list is lengthening. So I'm wondering is, given the current situation and the numbers rising, do we have enough staff to cover? What's your plan to cover that? And then with a secondary question is, as you've described a number of pretty amazing changes looking forward, how are we taking care of our staff to make sure that they're trained in all these changes so that we're not burning people out?
Thank you, Madam Chair and Commissioner. I'll talk specifically about the two items you talked about, but I think you're familiar that Deputy County Manager Allwood did a survey of staff in our building, which included Social Services Department staff, and it showed that our staff are tired. They feel overwhelmed, that there's things that we need to do as leadership to address their feeling a part of the work, and that decisions that are being made impact their work on a day-to-day basis. And being able to communicate that is a really important part of what we're doing. So I appreciate that the budget was presented and staff got to be able to ask the questions that they needed to be asked. By reprioritizing, you know, I don't know if that discussion took place with staff in MinChoices because I wasn't there at the time, and I regret to say that I wasn't paying attention to every detail of work happening in other departments. I think it was a good practical decision. But now what Division Director Keith Lattimore has been doing is to work with staff to offer overtime. Our staff are frustrated when they can't. They want to do what they were doing before, but whether it's bringing in temporary workers to do some of the reassessments or initial assessments, offering people overtime for some who have taken it up and said, yes, we'll do that because we have resources at the end of the year that we could use to provide overtime and temporary workers. So yes, our staff want to serve people, and they don't want to have to wait either to do that. So they're equally frustrated. So those are just really short-term solutions. The longer-term solutions really do rely on, for example, the Department of Human Services' willingness to consider the assessment and reassessment process. They take hours. In fact, I haven't done it yet, but one of our staff intends to fully take me through an assessment just to get, we're talking 6 to 8 hours for assessments. And that, I don't think that's necessary, right? Coming from the state and spending as much time as I did at that level, I think there are things we can do to change that determination process so that in fact people come into our system and the staff time spent in making that case can be reduced both on initial assessment and reassessment. So those are the things that we're doing right now, short of getting more money to do this work. The second thing I want to talk about is some work that we're doing with a group called ALEA. They've done some work on the working with many states and counties around change management and staffing changes in the foster care system. And I'm thoroughly convinced that we can do blind screening, we can do blind removal, we can do all of that work, but it won't make a speck of difference if it doesn't land with people who need to change the way they see their role in the child protection system. So if they see their role as one of safety and removal, because they're cautious or whatever, for whatever reason, that happens for a reason, right? Because, and I'm not gonna say it got rewarded, but you didn't get punished. So, there are things we need to do to help our staff feel ready for those changes, and to adopt some of those changes. So we will be looking at a contract, again, with groups who have done this work with other counties to help our staff know that supervisors, managers, directors, and me, and all of us, we have their back. That when they make decisions that may feel a little uncomfortable, and in fact, to you know, in the example that we talked about, we're gonna place with grandma and provide all kinds of support around grandma with mom and children, that if we do that, our worker won't feel like they're out there on their own, right? So those are the kinds of things that we need to do as well, and that doesn't just happen by saying, oh, we're gonna do blind removals, or we're gonna do any of these things, or we're gonna use signs of safety as a tool to make sure we don't remove somebody that we don't need to remove. We really have to prepare staff for this change. So we are fully undertaking over the course of the next 18 months a process of change management, particularly for that work.
Commissioner McGuire.
Thank you, Madam Chair. There's so much in this budget, and I just thank you so much, you and your staff, for all the great work that you do, and echo my colleagues' comments about how we do work with people in some of the worst times of their lives. I really appreciate Commissioner Mattis Castillo bringing up our staff, which I know is so important, and then Commissioner McDonough bringing up the idea of the kinship and families first. It's so important, and I really appreciate your focus on that. Just a couple of other things I'd like to highlight. I was struck by on page 11 when you said the target populations. I would say that we actually target families and communities as well, that we've got a lot of individuals here, and you really do work with the families and the communities, and I think that is indicated in the narrative and in the budget. And I would just say that that is really part of the work that we're doing, that we don't ever, it's hard to deal with any of these situations in their own, just with the child only. You have to deal with the family and the community as well. So just a couple of issues I'd like to ask you to highlight, and we know that our elderly are one of the fastest growing populations that we serve, and Ramsey County is seeing it faster than every other county. And so could you just talk a little bit about how we're working to serve our elderly, and if that's going to be part of another person's presentation, you can just direct me to that, or just ask me to wait. But I'm concerned about how we're working with our elderly.
Madam Chair and Commissioner, I won't ask you to wait, but there will be, Public Health will be doing some discussion around the systems work that is happening, of course, across the whole health and wellness service team to address, how communities support one another so people can live in their homes as long as possible with the kind of supports they need. So some of that has to do with the best understanding of community resources, housing, transportation, and so it's a lot of systems work. Mm-hmm. Where we have most of our work is really around the elderly waiver and alternative care, and where you see Medicaid resources, state Medicaid resources going towards providing services to people in their home. What we've already talked about, a little concerned about, is wait times for initial assessments, because you're not eligible for the elderly waiver until you hit 65. So if you're on the precipice, if you're not 65 yet, or you're not eligible for these waivers, well, you're waiting, right? So the main way we serve the elderly population or an aging population is through our home and community-based waivers. We do provide adult mental health services and other services as well, but that's the bulk of our program spending. And those are considered voluntary programs. So people come to ask, they ask for the assessment, they ask for the intake. So we'll still be providing those services.
Thank you, Madam Chair. And just one other, there's so many other other areas I'd love to have us highlight, and we've talked about mental health services, and we know that so many of our families have mental health and chemical dependency issues, and I just, if you could just talk a little bit about the chemical dependency. I mean, I see it in our, service area that we're working on, and And I know that we don't always have enough resources for all the things that we want to do, but talk a little bit about what we're doing for our chemical dependency.
So, Madam Chair and Commissioner, we have both detoxification services and chemical dependency services that take place within Ramsey County. We have just been notified that there is another detoxification program that is opening up in Ramsey County. It's I don't know if it's a not-for-profit or private venture, I'm not sure. But so we will have competition for detoxification services, and that's pretty unheard of. So we will see what that means to our detox services, but in addition to those services that we provide, we also provide chemical dependency treatment inside of our program walls as well. And I talked about that as an opportunity for us to bring new resources to the county with chemical dependency treatment and looking at both the co-occurring issues of substance abuse and mental health issues in one program at the same time. We also would like to bring primary care to that service delivery system and can do so by partnering up with public health and others who have been supporting us in our mental health services, but also in chemical dependency as well. People who abuse substances also have chronic health conditions that have to be addressed. So it's really working across both social services and public health to address those issues.
Well, I really appreciate that, and I just, know that we all agree that as many resources as we can put into mental health services and chemical dependency is appropriate. So thank you for all of your work in all of these areas and for really looking across departments and across service areas to get all this work done. So I really, really do appreciate that. Thank you so much.
Commissioner McDonough.
Oh, thanks, Madam Chair. I didn't finish the story. So I had gotten this call from the grandma at 7 in the morning, and then of course we did some reach out to child protection, and then I got a call from grandma about 3:30 that afternoon thanking me, her grandbaby, to let me know her grandbabies were in her house and they were being safe and they were getting the love but then also the understanding of what was going on. And the reason I raised the story is as we're working in this area that it was great. That day was perfect for her and her children, but my hope is that grandmas don't have to call county commissioners to make sure that we get things done. But there was a good outcome to that day and a good outcome for that family.
Thank you. Okay, any Commissioner Carter?
Thank you. I just want to reflect back also on the work that is happening in optimizing key housing functions, the new direction that's being set in that work, applauding our ability to align what has been developing, the rush work that Commissioner McDonough has been involved in, along with the table that meets regularly around mental health, the city and our hospital and county and others who come together. All of this has been building work. I heard recently in the mayor's budget proposal about work that the city is now introducing, familiar faces. And that certainly sounds a lot like our rush work. Mm-hmm. And I just wanted to ask if you'd speak a little bit to the hopeful coordination of that work. I know that I did hear in that budget presentation that the city is working with the county. I'm really thankful to hear that. But could you reflect on that for just a few moments?
Madam Chair, Commissioner, so that isn't in my budget area, and that will be presented by Financial Assistance Division specifically, but I too am hopeful to bring together the many services from across the service team to support the work.
So you can make me wait on that one then.
Yes.
Thank you.
I didn't want to say that.
All right.
Thank you.
But Madam Chair, just on that point, I do thank you you've got a line item here for homeless prevention and that work that we're doing to really help people from becoming homeless. And so thank you for that part of your budget. So, and the work that you're doing there.
Okay, any other questions or comments for Ann?
Thank you.
Hearing none, thank you very much. At this point, we do have a break scheduled. We're a little ahead of schedule, but I'm sure we will fill up the time anyway. So if you could be back here in 15 minutes, does that make sense?
Yep, so we have budgeted 17,000 and spent 20 and 18.
Okay. Corrections. It's found on page 402. Welcome back.
Thank you, Madam Chair, Commissioners. Good morning, everybody.
Good morning.
I'm honored to be here and very proud of the work going on in community corrections and the collaboration that we have across the Health and Wellness Service team. And the work that we're doing really across the county and with our communities. And I know you've heard me speak to this before, that we could not be where we are today without the support of the community members that we work with. I also want to say thanks to the board members, but to Ryan and Paul for your support too over the last really year. We've done a lot of reform work, a lot of changes, and you'll hear more about that here today. I'll be highlighting pages 402 through 419 in your budget books. First and foremost, talk about our vision from the county's perspective and from our department's perspective, a vibrant community where all are valued and thrive. Well-being, prosperity, opportunity, and accountability is really what corrections operates under each and every day. The values that we've created under the TARP project, and I'm happy to say I was part of the initial group that put those values together. We talk about people, integrity, community, equity, and leadership, and the importance of those values as we work every single day, again, helping people in Ramsey County from a residents first perspective. And of course, many of you heard me speak about our symbolic Hope Star, which really puts values again toward our work of helping people change, offering opportunities, providing accountability, and also ensuring equity throughout corrections. I think all of you have the Hope Star. I know Paul lost his. I'll get you new ones if you need one by the end of the presentation, and Ryan too. As a Community Corrections Act agency, we're here to make a real difference in the lives of the people that we serve. Again, from a residents first perspective, through innovations, effective services, and research-based interventions as well. We look at the research, we look at the data to make sure that the service we provide are really making a difference. In addition to that, we know there are tremendous disparities in the criminal justice system. We've heard some conversations around that this morning already. These are concerns of ours every single day, again, in community corrections, and we need to address those disparities and really tackle what we can in the everyday work that we do. We also need to do more work upstream. Early interventions we know are essential, and certainly will save resources when we don't have to use all the deep end work that we do. So moving resources upstream, moving services upstream is really part of the work of community corrections, and you'll hear more about that as we go forward as well. One of our primary goals in community corrections that you've heard me speak about and that Paul outlined this morning in the introduction to the Health and Wellness Service Team's priorities is more community and less confinement. We've been working very hard at strengthening our community-based resources, working with our community partners, vendors, and also retraining our staff to think differently about the work of probation and how they approach their clients, how we engage families, how we engage community in this work as well. And reducing confinement. And as you know, we've been making some significant progress in that area, particularly in our juvenile services area. This is challenging work. It requires ongoing community engagement and feedback, and resources that can support strategies which enhance public safety really throughout the county. Community Corrections, a few years back, developed a strategic plan with our organizational goals and charts, and that you'll find on page 403 through 404. We're working together to really develop a more positive, productive, and supportive culture. And I think Commissioner Manis-Castillo mentioned earlier, how do we support our staff? This is hard work. Every single day we work with people who are struggling. We see trauma every day in the work that we do in our communities as well, and we really do work hard to support our staff members who see this every single day in the work that they do. We're engaging our staff. We hire, retain, and promote staff, particularly staff that reflect the communities that we serve. We're providing listening sessions with our staff when we hear of issues that come up so we can get better feedback as management team members throughout the ranks, throughout the department. We also have an initiative called Secondary Trauma Work, where we brought in some national trainers to help train a group of our own staff to provide peer support services so that when they are under stress or a significant incident occurs, maybe a client is injured or dies, during the term of supervision, we want to make sure that our staff have the support they need and potentially move on to professional help if they need so as well. We have a lot of challenges, but also and a lot of changes going on in corrections. And in fact, as you all know, the Boys Totem Town program closed recently, actually earlier this month, officially on August 1st. And it almost feels like we're a moving company. And in fact, today, as I was driving into the office, right in front of me was a truck, the two men in a truck, movers who really care. And I thought about that in corrections, and really for us, it's community corrections, 500 men and women, agents, officers, support staff, managers who really care. We care about the work we do every single day. Right in the front row here, I've got a group of my senior leaders, and I appreciate the work that they put in every single day to work hard to really make a difference across our department. Just a brief overview of the department itself. So we have the juvenile services area that, again, many of you are familiar with, but the viewing audience may not be. We have juvenile probation officers that work under the JPO, or Juvenile Probation Office Unit. We have the JDC, Juvenile Detention Center, that houses youth in secure detention while they're awaiting either court disposition or an alternative placement. And we also had BTT up until August 1st, and I want to continue to recognize again the great work that our staff have done throughout really the last decade, the last 5 years since I've been here, but really the last 100 years of residential services. And we're moving now into a new direction. Community Corrections every year supervises around 500 youth that come through the juvenile probation system. We work hard at offering alternatives for those youth, and more recently, we've really pushed hard on family-engaged case planning, family-engaged group decision-making as well, to incorporate the families and the communities in the work that we do. We'll talk a little bit more here about BTT as well and some of the changes that have occurred there. Adult services, we provide adult probation supervision, roughly for about 12,000 adults every year in Ramsey County. Those services range they involve probation officers, assistant probation officers. We also work very closely with our RCCF, or Ramsey County Correctional Facility, as part of the adult services we offer. We have correctional officers that work out in that facility as well, mental health practitioners, and also skilled facilitators. Cognitive skills, providing education to our clients in particular, is a significant strategy that we've been utilizing throughout the department. All of our clients come to us through the district court. They're ordered onto probation supervision. So we're not out recruiting clients. We get clients from the courts and try to help get them through the system as quickly as possible, successfully as possible, assuring public safety as we go along. Our probation officers, again, supervise people that are placed on standard probation, but we also have intensive supervised release and predatory offender supervision for the high-risk clients that come out of the Minnesota State Prison System. And so we supervise those cases in particular under very specific statutory requirements. The Ramsey County Correctional Facility, as many of you know, has provided services for many, many years. It's a 550-bed facility. Fortunately, we have also seen numbers come down in the adult side as well. We also provide contracted services with Dakota County, housing their female offenders, both pre and post disposition. And the correctional facility, I'm proud to say, offers a lot of interventions for folks. Even though we're in a process of reducing incarceration, if and when someone does go to the correctional facility, they don't just sit there. There's a lot of programming that's offered for our clients in that program. And I thank the commissioners who have attended some of the graduation ceremonies. I think Commissioner McDonough had just mentioned that a few days ago. Commissioner Reinhardt, I know you've been out there a number of times. All of you at one point or another have come through to the Ramsey County Correctional Facility, and we appreciate your support. And I think just seeing the success that we have with some of the clients that graduate, whether it's the COG skills programs, the culinary arts programs, you see the smiles on the faces, you see the hope that really shines in some of the people that we work with. Services that overlap in both juvenile and adult probation services include risk assessments, need assessments, treatment referrals and programs, mental health assessments, chemical health interventions, drug testing. We are moving toward more electronic home monitoring alternatives as well, particularly on the adult side, and we provide those services. Community work service, restitution and victim impact statements, and a variety of investigations for the court. And in addition to that, again, programs that our staff provide themselves, the cognitive skills programs in particular. Community engagement has become a significant part of the work in community corrections. It's an important part, particularly when our communities are struggling and finding hope and trust in the criminal justice system. Our goal is to work closely with community members and even to bring back folks that have gone through the system and have experienced corrections so we can find out better pathways forward as far as how the services impacted them in their lives. We strive to connect communities with community members, particularly current or past users of our system. We engage in one-to-one meetings with community members. And through our JDAI work, Juvenile Detention Alternatives Initiative work, that again, all of you are very familiar with, we have a number of committees that meet on a regular basis that involve and incorporate community members that come in to talk with us about their experiences in the system or how we can improve or how we can move forward. We also have the Alternatives Governance Committee. Some of that work will be transitioning over to the TST, or Transitioning Systems Together, Transforming Systems Together process. And that work has been significantly important with a group of community members at the table to actually help us make decisions on how we reallocate resources into the community. The Juvenile Division in particular, Michelle Finstead, who's here, who helped chair that group for quite a while, offered a lot of unique solutions. Individualized funds for families to help pay for things like the first month of rent, potentially to help cover bills that families can't cover before they maybe get evicted from their living location. So we're addressing homelessness, we're addressing treatment requirements. Someone might need to get into school. We cover some of the initial costs to get someone into an education program. And again, very unique funding that's occurred over the last couple of years through that initiative. We also do annual client surveys. Been doing those for about the last 8 years. And I think the last couple presentations I've made, I've brought some samples of those, and I didn't do that specifically today, but what we're trying to accomplish is really to hear back from our clients. What was their experience? What worked? What didn't work? And what can we do better moving forward? We also have our Community Corrections Advisory Board. Chris Crutchfield, who's here as well, one of our deputies, helps to supervise and facilitate that group. Each of the commissioners here appoints someone from their district to be part of the CAB work as well, including people that have been through the system, who sit on our Corrections Advisory Board to help advise the department as we move forward. Our work in advancing racial equity. We fully recognize that our criminal justice and juvenile justice systems still exhibit tremendous disparities. Despite the fact that the population of Ramsey County is roughly 30% people of color, over 80% of the juveniles in our system come from families of color, and 50% on the adult side as well. We have significant disparities that continue today. Community Corrections is committed to reducing these disparities throughout our justice system, and some of these efforts have been shown to play out in some of the deep end work we've been doing, in particular in the juvenile system, to reduce placements, which we have done significantly. We've also initiated collaborative partnerships with local universities, and the Rabina Institute in particular is helping us to come in and do some studies on revocation reasons, why people get returned back into the prison system in particular. Community Corrections also has significantly increased the hiring, promotion, and retention of staff from diverse backgrounds over the past several years, moving toward our specific goal of reflecting the communities and the clients that we serve. We've also begun to reduce supervision fees. And I know we've heard some conversation around that earlier this morning. Supervision fees oftentimes have disparate impacts with people that are economically challenged, disadvantaged, and we're trying to reduce the number of fee barriers that have been set up over the years throughout the corrections system. And in fact, we just recently received a grant through the Arnold Foundation to study the impacts of fees really across the justice system, and we're partnering with the Sheriff's Office and partnering with the Safety and Justice team to really take a look at those impacts as we go forward. Some of the challenges that we see, which is on page 409, revocation reform. We are working hard on, again, more community, less confinement. Similar to our work on the juvenile side, we're also looking now into the adult probation side, where we have a number of every year over 1,000 people are revoked and sent back to the prison system. Our rates have been traditionally high, according to the Minnesota Sentencing Guidelines Commission. Therefore, we're again working with the Rabina Institute and with the 2nd Judicial District, with our County Attorney's Office, public defenders, and with our community members to look at why those rates have been as high as they have. The good news is we have seen a slight downturn over the last couple of years, but we have plenty of work to do in that particular area as well. We also have challenges with our IT and technology services. We have some outdated systems. We're trying to incorporate systems that across the justice system, work with the courts, work with law enforcement. We need to make sure that data is accurate, that we have it in a timely way, to make sure that if a warrant needs to be issued or something specific is related to a client's intervention or supervision, that we have that data, that it's accurate and reflective of the work that we need to do. I thank our IT partners. IPR, Karen Francois' division, has been very helpful in this area for us as well. Opportunities and more reform work. So enhancing cognitive behavioral programs is a big part of the work that we're moving on forward. And you'll see in our budget performance measurements that show up on page 411 and 412, we talk about reducing placements, but also providing alternative services for youth as well. So enhancing COG programs out into the community. This is a big push for us on page 410. Drug testing that's less invasive and less costly, involves more technology and eliminates fees. Providing incentives for clients who don't, instead of consequencing people for failure, we want to provide incentives when they do well. What can we do to support their success going forward as well? We've increased the use of technology on drug testing as well. That's less invasive, less costly, and actually provides us with quicker results. Reducing supervision and testing fees and the disparities I've already talked about have been significant work in our department at this time. So the BTT program, as I mentioned earlier, after many, many years of exceptional service, our numbers came down to a point where we were at 6 youth at the beginning of, I think, March, and ultimately ended up with 0 youth in July, and made the decision to close the program. And again, I thank the board for your support. This was a very big decision. It was very complicated in many ways. And in particular, we really wanted to support our staff. Dedicated, highly trained, experienced staff that we did not want to have them left out there without really a good direction for their future. So we've reallocated a number of positions. Around 40 staff have been reallocated, reassigned into different parts of the department. All of those reallocations are really focused on reform work. One example is we had a number of COG skills trained facilitators that were running groups with our youth in the program. Those staff have now been reallocated and are running the same interventions in a community-based setting, and will continue to expand that over the course of the next couple of years. Research actually shows that those interventions in the community are more effective than they are in correctional treatment programs as well. We've also shifted some staff resources into the adult division to help look at reform work on the adult side. We know that we have high revocation rates, in particular men of color, 18 to 25 years old, who come back through the system on a regular basis. And if they get placed in a correctional facility, particularly a state facility, the services they receive are very minimal. There's not a lot of treatment offered, not a lot of resources that are available to a shorter term client in the prison system. So our work is shifting to look at that. What can we do to keep some of those clients here in Ramsey County, maybe at the RCCF for a short stay of time, but more importantly, back into the community as quickly as possible so they can maintain work, they can take care of children, they can maintain family requirements that they have, education programs as well, and still have supervision, whether it's electronic home monitoring or other forms of supervision, GPS tracking that we can do if there's any risk issues that we have to manage. With BTT as well, we are addressing other specific areas. We're looking at more family engaged treatment, programming with our clients. We are also enhancing what we call a community access approach to help clients with transportation needs to make sure they can get to programs. That's one of the issues you see in particular in the juvenile world, but also with our adults. If we have programs or services available, whether it's locally in the community or maybe it's at one of our partnering agencies, Ujamaa Place or Neighborhood House, we got to make sure people can get there and that we support their transportation to and from these programs as well. So COG, transportation, family engagement, addressing homelessness as well. And in fact, we have a recent grant with the RCCF, and Tina Curry has offered us a position to help us with, through the Polad Foundation, to actually address homelessness coming out of the RCCF. There's no way we should release someone out of a correctional facility and they have nowhere to go. That is unacceptable, and we are trying to address that issue every day as well through our correctional interventions. We also have enhanced mental health services for both our juveniles and our adults. And a lot of work is continuing to move with the BTT reallocation. And really what I'd like to do is come back to you in early 2020 with a workshop to go through more details and talk more about those specific moves as well. So far, the work has been, I think, very positive, very in-depth, and again, reform-focused. Pages 411 to 412, reducing juvenile out-of-home placements. I know that you have all heard the story. We've done some significant work in the reduction of out-of-home placements for our youth. If you go back to 2014, 2015, we would have at any given day 140 to 150 youth in out-of-home placement. I like to say, as of today, Michelle provided me a report, we have 28 youth in out-of-home placement as of today. So a significant reduction again in those programs, and more community-based services that we're developing moving forward as well. Most
John,
of those youth, yes.
I think you need to repeat that again. I mean, this
All right,
is.
let me be clear.
This is actually, I mean, really incredible as far as the work that you are doing and the outcomes for children. So just one more time.
Yeah, thank you, Commissioner. I appreciate that. So again, go back about 5 years. On any given day, we would have 140 to 150 youth in out-of-home placement, locally, but also throughout other parts of the state and even outstate as well. As of today, we're down to 28 youth that are not out-of-home placement. We've also reduced the number of youth in really high-end placements like the Red Wing Correctional Facility, where at any given time we maybe had 20 or 25 youth. I believe as of today we're at about 6. So significant, again, reductions, which also has led to some cost savings and is part of our reform reallocation with our dollars in the juvenile services system as well. Adult.
Again, I think that, I'm not going to make you say it again, but.
I'm willing to if you want.
But the fact is, it's not that the children aren't getting the services that they need. It's not taking them out of their home.
Yes.
So it's a reallocation and doing things, again, the idea of moving things upstream so that you are getting better outcomes. It's not just a reduction in numbers.
Yes, thank you, Madam Chair. And I will say crime rates have remained low or stable. There's no increase in high crime rates. I know sometimes the media picks up on some of these stories too, but really we are still working with these youth. We are providing services. If anything, we've enhanced services with the families that we're working with. We actually have an initiative we're looking at right now, potentially with Ujama Place, to look at the EJJ youth, or our extended juvenile jurisdiction youth. These are high-risk youth, ages 16 to 21, that we supervise in juvenile probation. And we're trying to figure out a way to work more closely in the community with youth that need that type of service as well going forward.
Thank you.
Do you want me to say it again? Or? I can repeat it at the end if you want. And again, adult revocations. We're trying to reduce the number of people that are revoked back into the prison system because the services really are minimal and the disparate impacts are tremendous for the people that we have. And we are considering public safety. We are looking at the details and making sure we're supervising people closely if they are back in the community. We're also trying to work with the Department of Corrections to see if we can get some support as they look to reduce their incarceration rates as well across the state system, which is constantly under pressure, whether it's staffing issues or finances or resources in the prison system as well. And again, those outcomes 411 through 412. The budget numbers. So reviewing the budget, just overall, and I know this is Lee's area here, our department is remaining stable within the limits that we've been given as far as our budget is concerned. The total department budget allocations is around $73 million. It's a lot of money. And we also bring in about $15 million or so in revenue, leaving about a $58 million impact on the levy. Around the same numbers for 2021. And this is why we are here to talk about reallocation. We're not here to ask for more dollars or new dollars. We're actually here to reallocate dollars. Some of those savings are coming from, again, the reductions in the out-of-home placement dollars that we've had, close to $1 million or so in that area. We've also reduced, as I said earlier, the red wing or the incarceration rates that we have for the high-risk youth as well. That has saved us a couple $100,000. And then Boys Totem Town over time will save us money. We just have to make sure we're patient, we get staff reallocated, and that we make sure we've covered the expenses to decommission the property and take care of all the pieces with the facility and with the grounds itself. We are also, again, enhancing training for staff, family engaged case planning, family group decision making, training staff to make sure that they have a vision that really matches with where we want to go as a department in the direction we want to go. Our budget numbers are within, again, the targets that we've talked about. With BTT, the challenge with the budget this year for us was we had already submitted the numbers in, and then the decision was made to close the BTT program. So you see line items that include BTT in 20 and 2021. And again, those will be reallocated, and that'll be part of our conversation with the board as we go forward through board workshop and potentially through, again, a budget amendment sometime in 2020 when we get a better handle on where those numbers actually sit. We are not asking for any new FTEs. There's only a 2 FTE change in our budget, and it's really related to more of a system issue that came up with some grant dollars that we had and 2 positions that were just put into a different category. So despite you see the 506 to 502, it's really no new positions are being added into the department. I'm very proud of our partnerships too across the health and wellness service team. The work that we've been doing, particularly in closing BTT and reallocating resources, could not have been done without the help of social services, with public health, FAS, financial assistance services. We continue to have a great partnership with our veteran services group as well, working in the treatment courts on the adult side. And also through Karen Soltis' help with technology and some of the health and wellness administration issues that we run into that we're trying to repair as we go forward. So in the reform work, we've seen fee reductions. We're working hard on the Transforming Systems Together work that Ryan did a great job on, I think, at the board workshop last week that I attended. Transferring 1 position out of community corrections, which is our JDI coordinator position, over to help with the Transforming Systems Together, along with some of the alternatives governance dollars that we've had set aside through corrections. Juvenile residential treatment services, we are continuously working to enhance additional services in the community. Local programs that are small that can take in youth and work with their families is really the preferable route that we're moving in versus sending kids to large correctional institutions of any kind. Transportation for inmates at both the adult correctional facility and in juvenile detention is certainly another reform area that we need to emphasize. And we've taken over juvenile booking, which I know we've talked about that here as well. The fact that we've had youth booked in the adult detention facility through the sheriff's office really did not comply in many ways with different rules and requirements. It wasn't really the right thing to do. So we've moved booking over to JDC. That has successfully been implemented as of, I believe, July or June. We started to get our youth coming into the booking process. We've added some staff to help with that process, and overall it has gone very well. So what does the reform work really mean for our clients? And I just want to spend a couple minutes from a client's perspective. What does this mean? So in today's world, we are meeting clients where they're at. We're working with places like the Opportunity Center, homelessness. We're going to have agents that actually go out and meet people, have appointments, and don't require them to come into an office appointment when they don't have transportation or have a place to live. We're working with them to help them with jobs. Community service providers, such as Goodwill, Neighborhood House, and Mujama Place. We're strengthening those partnerships as well going forward. We're making drug testing more accessible, using technology that's less invasive. We're maintaining ongoing relationships with our clients. Keeping families together whenever possible is a significant goal of ours. Building trust and familiarity with the system that we're in and getting input again from our community. And really accountability that talks about teaching people new skills, helping them successfully live their lives and be successful and prosperous here in Ramsey County. We're going to enhance our future community-based COG programs, decision points, thinking for a change, other programs that we utilize that really help teach specific skills that are not just good during the term of probation, but can be utilized forever in someone's life as they go forward. We're enhancing mental health services from a client's perspective. We want them to come in and get an assessment quickly. We want to make sure if it's a chemical health or a mental health issue that they're not stuck waiting, particularly in an incarceration situation, to get an evaluation and assessment. So we're looking very closely at that, particularly with the help of Liz Reitz and Al Carlson who are here from the RCCF. We will see, I think, better responses to those assessments and better response times. We're also looking at crisis response teams to go out into the community to help if a youth is struggling, whether it's in a foster home or whether at home, how can we respond as a probation department to avoid the potential of a law enforcement intervention that could pull a youth even deeper into the system, and we can safely handle that type of situation. So in the past, a client would come in, They would maybe be referred to a program. If they failed, the standard procedure was usually maybe a warning, could lead to a warrant, could lead to a probation violation, court hearing, and next thing you know, you're incarcerated and you start all over again. You may have lost the good time in the program that you've done. The new vision is really not to do that. The new vision is to look at helping a client who's struggling, meeting them where they're at, going out into the community to find out why they missed an appointment. What can we do to help encourage that, enhance that? Doing one-on-one COG interventions where we meet one-on-one with someone and not just talk about conditions of probation, but what can you do differently? How can we help you problem solve? Go through some actual steps to help you pay that bill, help you figure out childcare for your family, help you not only get a job, but retain that job going on in the future. So a lot of things that are going to be more in a proactive way that will hopefully avoid the more correctional response we've seen over the years. And speaking of COG, I usually try to bring some kind of a memento for you guys to remember the work that we do. And what I have that Yvonne's going to hand out for you is what we're calling the Commissioner's COG Toolkit. So she will pass these on, but these are actually skill cards and examples of the work that we do with our clients. Teaching people problem-solving skills, positive ways of thinking, turning negative thoughts around. Of course, there is a copy of the Hope Star in there in case you forgot what that stood for. And then I have a master copy as you go through your budget decisions and you're trying to problem solve. I have a master copy with more detailed steps that I'll pass to Ryan or to Paul so they can help you go through those problem solving steps if they're not detailed enough as you go through the budget. And really, I want to go back to thanking my staff, putting a ton of work into this budget, looking at the numbers, reallocating to make sure we stay within our budget limits and really move in a reform-focused direction, and expanding that from the juvenile divisions into the adult world, into RCCF as well. That is important work. We must continue to do that. We need to work further upstream. Jennifer Schuster-Yeager, Francis Odiambo, Oscar's here. John, thank you for your work on the budget as well. And really thanks to our community members for their ongoing participation and support of the work we do in corrections. And thanks to you, commissioners. You've been very supportive, very appreciative. I really appreciate seeing all of you at the BTT closing ceremony. I thought that was a very powerful moment for all of us to look at the different world going forward and actually closing a facility and moving in a different direction as a county. Thanks, Paul, for your support too as well, and I'll get you that Hope Star. So. And that's all I have right now, and I'm open for questions.
Okay. Questions? Commissioner McGuire.
Thank you, Madam Chair. I'd like to go, last so that all my colleagues can ask all the other questions I might have so that I can add to them. But I just have to say thank you to you and your staff for your vision forward and for really taking those major steps and making those tough decisions to do things like really work with JDAI and alternatives so that we can close Boys Totem Town. And this is a great packet. I love this. This is wonderful that this is the kind of thing that we're really working with our clients and our residents on. Positive thinking, problem-solving skills, building safer communities. This is all really amazing work that you're doing. Just thank you so much. I have been, involved in the Community Corrections Act field, or the Community Corrections field for since my legislative days, and I want to thank you, Chris, all the people that are involved in that. I know we've got a conference coming up that we're very committed to, and I know that that's the kind of work that really helps us do this. This very visionary work is to really build the capacity in our communities to work with our young people and our youth. So thank you so much for all of that work. And just want to say that, I look forward to continuing to be a partner with you in whatever we can do to help you with that. And if you need any legislation, I know we're always needing more revenue from the state for our community corrections formula, and just committed to helping you with that. So thank you so much for all of your work.
Thank you, Commissioner McGuire. I appreciate that.
Commissioner McDonough.
Thanks, Madam Chair. And you touched on it in your presentation, John, but, you know, the work that we're doing with PMF on the fines and fees reduction, I think is going to be really critical moving forward and certainly going to be a part of the budget process. But that work really is going to be important here for us to be moving forward and to start planning and preparing what that means to your budget is going to be really helpful, because we can't make this a budget issue when we're talking about these fees and fines and the work we're doing here. And then, of course, the work that we're going to be doing in the CJCC on bail reform is going to be the same kind of issue, and, you know, other parts. But, you know, I talk about this in a way where, you know, a major CEO in our community that makes $26 million a year gets a $180 speeding ticket. It's nothing, right? A mom with 2 jobs, she just got done working 2 jobs. She's rushing to childcare to pick up her child before it closes, and she gets a $180 speeding ticket. And, you know, it comes time to pay that, and she's already living a life in survival mode. She's always going to choose survival over that ticket. That ticket becomes a $1,800 with fees and fines. She loses her license. She has a warrant out for arrest. She ends up in her jail. She loses her job, all for that $180 ticket. And it's just absolutely crazy how we've done this, and we've got to make some major changes. You know, within your system out at the workhouse, someone who has to come in and go into the facility, but is fortunate to have a job, we charge them to be able to go back out in the community, to be able to keep that job and be able to support their family. At the same time, we're investing in job training programs with folks in our system, right? And here we are taking money away from somebody who's already, you know, being able to take care of their family. And then on the other side, the same day, we're doing work to actually help get people back out in the community and to get jobs. So I'm really looking forward to the work we're going to be doing with the consultants, but really thinking about how we prepare for that budget piece, because you know, attaching the budget to the mission, the vision, and our values is so important. And we've got a lot more work to do in corrections to actually attaching our budget to that.
Yeah. Thank you, Commissioner McDonough. I echo all of what you said, and you're exactly right. The disparity impacts are tremendous, and they can be long-lasting, impacting someone's credit record, keeping them from maybe getting a loan if it goes into revenue recapture. So we are certainly looking to move away from that process, which started over a decade ago, and we need to change that. So thank you.
Commissioner Carter.
Thank you. I would, again, share, as all others have, my commendations to your department, to the leaders in the department at all levels who have acted to make this thought of reform an actuality. None of it would ever have happened without the top to bottom, bottom up work that's been done over the years in corrections, and your leadership across systems has enabled other systems also to participate with you in enhancing this reform. We've talked about the work to close Boys Totem Town, you know, which required integrity, grit, and just a lot of hard work from your staff, and really appreciate all that's happening in the various areas of support. Commissioner McDonough just mentioned a couple of those, the work that you're doing in probation revocation and working with the state to reduce the number who have to come back into our systems. And thank you for the performance measures that you've set forth to ensure that work continues. I also want to recognize how long this has been going on, and the difference between the number of young people that we bring into our detention center since the beginning of that work to now is tremendous, knowing that we had about 3,000 or 4,000, depending upon how you count, you know, which population you count, at one time back in 2005. And now, I think in 2018, we were under 800. I believe that to be the case. So that's extreme reform work that continues now. Can you talk a little bit about the status of the detention center population? I know from time to time it's down at maybe 7 or 8 in detention, sometimes higher, but could you just speak a little bit about that and the trajectory as you see it?
Yes, thank you, Commissioner. I appreciate the question. The JDC numbers are certainly down significantly from where they were if you look at 2005, where on any given day there too, you might have had 80 to 100 youth potentially in our facility. We do average now about 15 to maybe 20 youth on any given day. I believe the population today was around 18. Okay, so around 18. Michelle knows these numbers. She sees them every day, and I appreciate the tracking that goes on in our department, because it really is important that as leaders we pay attention to this as we go forward. I do not foresee a trajectory where we're going to see any sort of a big increase in those numbers or anything like that. I think what's happened in corrections is we have also shifted some of the work our staff are doing, because traditionally detention centers don't offer a lot of interventions. It's basically a place to do your time and wait for the next stage of whatever's going to happen in the justice system. But we've really tried to offer additional programming as well, whether it's educational programming. We actually do some short-term COG skills programming as well with our youth, even if they're just there for a few days, going through a decision points exercise to help them think through their problems and spend time with staff is really important. Additional mental health assessments as well are available, chemical health. So I think we've really tried to incorporate additional services with the time that our staff have, with the numbers being down like they are. Of course, it's challenging work. Detention center work, just like working in a jail, it's challenging. It's a fluid population of youth coming and going as well. We still struggle sometimes with getting our girls out faster into programs because we have less resources for our girls, and that's another big area that we've got to take a serious look at to make sure we provide the right services and have services that can turn around much more quickly for our youth as well. I think our average stay is still around 4 or 5 days, right around there. So some youth are in and out much quicker, some stay a little bit longer. If it's a real serious crime and they're waiting a trial or something like that, they would stay longer. We've also tried to incorporate more family input, getting families to come out and see their youth, engaged with them, getting our POs involved as early as possible so that we can try to get a smooth transition going out. And then, of course, the RAY work, our risk assessment instrument that we use, that we've been utilizing for a number of years, really diverts a number of youth. If they're not a public safety risk and there's not a big threat that they're not going to show up for court, we will release them into the community under certain conditions and under certain levels of supervision. But they do not need to be in the secure detention setting in those instances. So I hope that answers some of your questions, and happy to talk with you more about that too.
It does. I appreciate your going through that. Thank you.
I have another question. I have
Yeah.
Commissioner Modis Castillo and then McGuire.
Thank you. Thank you, Madam Chair. I just want to compliment your work. I can tell you as a new commissioner, when I took my tour, and I've shared this with you before, I expected grim circumstances of the workhouse. And instead, what I saw was a compassionate staff with people who saw the clients there as people and that were really working and putting care into the system and to make sure that they're successful. And so thank you for that work.
Yes.
I really believe that you put community in corrections. I've seen it firsthand. You're doing great work, and it truly is speaking to our transforming systems together. And it is unfortunate that sometimes I've talked to people who have left your facility that said the best I've ever had it was there, which tells us why we have to transform systems upstream. And so your folks and all the people working with you now moving into that direction really is a significant benefit to our community and a really good investment as putting our residents first and transforming systems so that their best care isn't in a correctional facility, and we don't want to reduce the quality of care there, but truly moving it upstream so that our community is thriving. So just kudos to you and really great work and putting community in corrections.
Thank you, Commissioner. I appreciate that. Kudos to my staff, really, who run the facility, and the staff that are out there every single day. They do tremendous work. They really care about the people. They want to make sure. And it is sad, like you say, if someone comes in and this is the best services they've had in a correctional facility, but we will continue to provide excellent services and hopefully, again, do more work in the community. I didn't mention earlier, we're also working with Workforce Solutions, and they come out to the facility to help make those connections for job training, applications, interviews, all that kind of stuff to support that transition out. And then with FAS coming in to make sure we don't release anybody into a situation where they don't have a stable living situation. That's a tremendous need. And we also have a full-time person, Gail Morkey, who does a lot of reentry work. So she runs seminars on a weekly basis to run through all kinds of options and scenarios for our inmates before they would leave the facility so that they have the information they need, whether it's about jobs, about education, medical treatment, prescriptions, paperwork, identification cards, all that kind of stuff. We try to really make sure we cover that very thoroughly. So when they leave, those barriers have been reduced, hopefully significantly. So thank you.
Commissioner McGuire.
Thank you, Madam Chair. Just a couple of other things I just want to call out again. Your really dedication to the early intervention and the prevention, to call out again that you're part of a service team that includes corrections, public health, human services, and you really are committed to that model of the early intervention and prevention, whatever you can do in the area of community corrections, that you're there. And then to thank your staff, which I neglected to do earlier, just for being out in the community. I know that we've got your people that are serving on all of our boards and committees, and Michelle serves on our North Suburban Family Collaborative, and just the dedication that they're providing to our communities. Just thank you so much. But I did want to ask you to highlight a little bit more, maybe some of the work that you're doing with our clients and our residents that have mental health issues, because I know that unfortunately we see a number of them in our correction system. And if you could just talk a little bit about how we're addressing those issues.
Yeah, absolutely. Thank you, Commissioner McGuire. Mental health certainly is a significant challenge and a major piece of our work as well in corrections. We do have staff, mental health practitioners, mental health supervisors that work, particularly in our correctional facilities, but they also go out into the field to do assessments and to help with readjustment, potentially if someone's being released from a facility or if they're just on probation and they're having struggles as well. Those staff members are highly trained, very dedicated staff members that really try to connect our clients into resources in the community wherever possible. And it's, again, even beyond the term of probation, we want to make sure that if they have mental health needs, that even once they move on from our system, that they have those supports going forward as well. Our mental health staff, they connect with public health, they connect with social services, they connect, I believe, with other healthcare agencies in the community as well to really support that work. And ultimately, we don't want to see people incarcerated because it's a mental health related issue. It's just that's not the answer. The correction system has sort of become the default for a lot of this work. And really, there's better ways to address this in the community and other settings than in a correctional facility. So,
Thank you. It's a good call out for all.
Yes.
For our human services that in our prevention work, that we don't get them to that point.
County Manager O'Connor.
Thank you, Madam Chair, members. I just want to go back to a point Director Clavens brought up during his presentation. I think it's a big deal in terms of dollars and staff. So page 415 highlights Boys Totem Town, projected proposed budget of 4.7 million almost in 2020 and 2021, and that involves 45 FTEs, which are listed on page 417. So just to be clear, the decision to close occurred after the budget was created. We knew we would have a challenge with that, but we decided that challenge was the right challenge to have at that moment in time. And so we still, John talked to you at a high level today about how to reallocate that 4.7 million within the department toward different use and those 45 FTEs. There needs to be both a intermediate or shorter term plan as well as where we're going in the longer term. A significant portion of the funding or the proposed budget number ties up in those 45 FTEs. Correct. So I want to highlight that piece. But as we talk about fines and fees and we talk about that work and where we may get some opportunity, we talk about the staffing needs both in youth and adult areas. This is where it lies. And so before the year is done, before the final budget comes before the board for discussion in December, we'll have a draft of what that vision looks like going into next year. So you all have an opportunity to review that.
thank you, Ryan.
Okay. Any further comments? I guess one thing that I would like to talk about here as well, and it goes through our entire budget actually, but you really highlighted it very well about the measurable outcomes that we have in our budget. Not only do we have a 2-year budget, but we measure our outcomes. And so I know that we often get questions in the community about, well, how do you know if you're being successful? We have measurements. And one thing that we have been very adept at is if something isn't working the way we want it to, we look at different ways to make it happen. And the way that you have laid out your budget especially is very clear in that, but it does go throughout our entire budget. So I just wanted to highlight that.
Thank you, Madam Chair. Appreciate that.
Thank you. Okay.
Thank you.
And thank you for the little kit
I'll
here.
leave the detailed instructions with Paul. Thanks, Paul.
Okay, and then for this morning's session, we will complete with public health. Kathy Hadeen, the Interim Director for Public Health. That is found on page 366.
Gave me the packet to keep me going this morning, so you're gonna need to watch this, by the way, since I'm a little under the weather. I give it back to you.
Welcome.
Thank you. All right, good morning. Good morning, Madam Chair and Commissioners. I'm Kathy Hedin, and I'm the now seasoned interim Public Health Director. The last time I was here providing performance measure updates, I had 20 days of experience in my role, and now since I've had a few more months, it's really no excuses. I should be able to answer every one of your questions, and we'll keep moving on. I couldn't be here providing you with these remarks without our hardworking public health staff. From those who work directly with our community each and every day, to the supervisors and managers, accountants and contract staff, interns, and everyone in between. It takes each and every one of us to run a full-service public health department, and I'm proud of the service we provide with and for our community. I'd like to thank each of the department leadership team members, many of which are here today, for helping me to prepare for today, and particularly Diane Holmgren, Dan Rakala, Janelle White, for your time, your extra time. I know you've put in a lot of time, making sure our budget is in alignment and we are all ready. As you know, you are all the community health board for our public health department. You are consistently supportive leaders who push us to be better. Thank you. Our purpose as a department is to work in partnership with residents, community partners, and other units of government to promote, protect, and improve the health of the community. We continue to sustain our national accreditation status, and recently we joined you at a board meeting outlining our community health assessment and our department strategic plan. I'm not going to go over all of that since we were just here doing that, but I would like to highlight 2 examples of our 4 strategic themes. The first one is taking action to advance racial and health equity. This theme follows the guidance and leadership of the county's Advancing Racial and Health Equity in Decision-Making strategic priority, and will continue to guide our work as we invest in a workforce that reflects the communities that we serve. The other is partnering to champion prevention across the lifespan. It sounds a little lengthy, so I'll give some definition to that. This theme takes on the responsibility of being a prevention strategist, where we continue to build capacity and proficiency within the department to effectively work within our service team, across service teams, and with community. Our goal is to ensure that the public's health is influencing decision-making in multiple sectors. This is done in a way that honors the science behind our work, and it helps us lean into the expertise of those around us. There are many examples of how we partner across Ramsey County. As prevention strategists, we work with staff from parks and public works on supporting active communities, for example, active living. And with safety and justice by providing opportunities and resources to improve access to healthier food for residents while in our correctional facility, and access to healthy options when they leave. We're partnering to reimagine the child welfare system with our colleagues who are leading this work from social services, and offering resources for families through our nurse home visiting program, Club Mom and Club Dad. It's important to mention our intentional focus on 0 to 3 initiatives with our family health nurses, child and teen checkup, and in partnership with our health and wellness admin department, not ours, but in partnership with health and wellness admin, financial assistance services, all working with Pritzker to ensure children are ready for kindergarten. Our WIC division continues its partnership with the school district as another way to ensure schools can connect with families earlier who are needing more resources for school readiness. On the other end of the continuum, Ramsey County continues to build capacity to be an age-friendly community. Measurements will include healthy and active aging, transportation, housing, civic and social inclusions, among others. This year, we'll begin the assessment process developed by the World Health Organization to learn more about how Ramsey County can become an age-friendly community. As a public health department, it's also our duty to maintain the capacity to assess and respond to local health issues, including the investigation of health threats and containment of disease outbreaks, promoting healthy communities and healthy behaviors, and preventing the spread of infectious disease, protecting against environmental hazards, and assuring both quality and accessibility of our health services. As Dushani pointed out on page 44 earlier, we've got a few major changes that I'll dive into throughout my remarks. At the time of this budget printing, we reported an increase of 5 FTE. This includes 1 planning specialist for the Healing Streets project, which is our innovative strategy for group and gun violence prevention and intervention, funded by reallocating public health levy funds. We've got 2 FTEs for our WIC nutrition educators to provide WIC services to residents. And the last 2 FTEs are in environmental health. 1 is for a health educator who will be a community engagement specialist for waste management activities and will manage the county's recycling ambassador program. The other is a planning analyst who will focus on coordination of evaluation and climate change adaptation. On page 366, you'll see our personnel numbers will go from 324 FTEs in 2019 to 330 for both 2020 and 2021. Our department levy is noted on page 375 and 376, increases in 2020 by approximately 5.5 million, reflecting the levy shift of correctional health from the healthcare services budget to public health. 25% of our budget is funded through federal, state, and private grants and continues to rise as additional grants are received. After February 2019, when the budget was prepared, the department was also awarded a CDC grant through the Minnesota Department of Health to work in partnership with primary care and mental health providers within the community, as well as internal departments, including clinical and correctional health services, community corrections as well, to prevent and manage diabetes, heart disease, and stroke with an emphasis on health disparities. As County Manager O'Connor mentioned in his opening budget remarks a couple of weeks ago, and as Deputy County Manager Dr. Allwood mentioned today, we're taking intentional, focused actions to prevent and address group and gun violence through an innovative strategy called Healing Streets Project. You'll find that on page 370. There is a typo. It has a different name, but it is called the Healing Streets Project. We're taking a nudge that we received from the County Attorney's Office, and we'll be partnering with them, community corrections, and other law enforcement agencies to work in and with community to provide a more healing response to group and gun violence. In a recent board meeting, Commissioners Mattis Castillo, McGuire, and Reinhardt, all of you shared that you participated in a wonderful community event on Rice in Maryland. This is an excellent example of what we need to be doing to build community that will help us build trust and trusting relationships together. Other areas of focus within the Healing Streets Project will include grief counseling for survivors and community on both ends of gun violence. Community health responders will be identified, paid, and trained. They will be provided with community health worker training thanks to the Workforce Solutions Pipeline to Prosperity program. Community grief dinners will be led by facilitators in the community, multiple locations around the county where group and gun violence is more frequent. A community partner like Gabby of Real Life Coffee and Yoga is an example of a business owner who is investing in community to ensure more peaceful relationships. We will make sure that Healing Streets is building relationships with her and others in the business community. There will be 3 dinners before the 3 dinners will happen before the end of the year, which will provide an assessment for this work, for the focus and prioritization of this work beginning in 2020. Other key aspects of Healing Streets Project is building relationships with key law enforcement investigators, building trust with community elders, working with schools and hospitals, and building communication strategies with community partners. Healing Streets connects the Public Health Department to an integrated approach to health, wellness, and justice strategic priority, and will inform the Transforming Systems Together work with real-time community-based needs. This is a great opportunity to invest in our community. I imagine we'll bring an update in front of you in the form of a workshop in about 6 months to a year, I would think. And if the work happening with a similar program in Minneapolis says anything to us, we'll probably be back in 2 years talking about a bigger innovative ask for a Healing Streets. But we're not supposed to do that, but I'm just giving you a heads up on that one. It's important work, and it takes a lot of investment to do the right thing. Community engagement is a strategy and a transformational tool that we use across the department. Whether it's through baby cafes, community health assessments, birth equity community council, or community health improvement plan action teams, we strive to practice good community engagement. One example mentioned earlier is our Recycling Ambassadors program. This program will recruit, train, and support resident volunteers throughout the county to engage in activities related to waste reduction and recycling. The 2018 to 2038 Ramsey County Solid Waste Master Plan's emphasis on environmental justice and racial equity creates a framework for uncovering and deconstructing the underlying assumptions that contribute to and produce unequal protection for people in their interaction with the environment. Ramsey County has moved beyond traditional education about recycling and waste reduction to a community engagement model that partners with others to build momentum for system change. Adapting our approach from community education to community engagement is necessary, not only to achieve the recycling and waste diversion goals, but is also critical to ensure the community has the needed training, education, and understanding to make decisions about environment and well-being. Before I close, there are a few challenges that I'd like to highlight. We continue our work to address multi-drug resistant tuberculosis. We're grateful for the additional FTEs that you provided us previously. Addressing TB is a critical core function of public health. The department continues to see new cases of multi-drug resistant and complex pan-sensitive TB in the community. These cases are very complex and are managed intensely for up to 3 years. They require frequent monitoring and follow-up to ensure that the treatment is successful for the individual, family, and community. In addition, latent TB cases, it's a little technical for even me, so I do a little explaining. People who have TB bacteria but are not infectious and do not have active TB, so it's latent TB, need to be adequately managed so that there are fewer conversions to active disease threatening the public's health. From a financial perspective, we will continue to see needs in staffing since these growing cases impact the burden of work for our medical, case management, and directly observed therapy staff. In addition, we may see growing medical costs as they relate to diagnosing and treating contacts, suspect cases, latent TB, and active disease. There will be a workshop on October 8th to provide more in-depth update on the status of the situation and our work. As noted earlier, a quarter of our budget is grant funded. Our expertise and hard work allows us as a department to compete and succeed in obtaining grants. But know that not all are as stable as we'd like. One example that you'll find on page 377 is related to some changes in our budget to reflect the end of a housing and urban development, or HUD grant, for lead hazard control. This funding year is coming to an end, and as with many grants, there's uncertainty if that funding will be available in the next round. Beginning with 2018 and 2019 budget, you approved the use of solid waste funds as outlined in the Solid Waste Master Plan for work on lead and healthy homes. We plan to continue to apply for HUD funding for the window replacement work and have plans for both funding scenarios. We also know that our community has been burdened by the recent federal government restrictions on Title X funding that will likely affect access to family planning and sexual health services to clients who visit Clinic 555 at the Public Health Center. We'll monitor our client visits to assess and evaluate any increased needs. As a component of our infectious disease control role, We are monitoring the state's hepatitis A outbreak, and while it's not considered an outbreak here in Ramsey County, we'll be providing Hep A outreach immunizations in the community through a partnership with Higher Ground and other health providers as a preventive measure to keep Hep A numbers low. While these challenges will indeed challenge us, I have no doubt that the experts at all levels of this, I'm going to keep going with this hardworking service team, department, the department will, we're gonna start over with that. I have no doubt that the experts at all levels of this hardworking health and wellness service team department will continue to exemplify our county's values of people, community, equity, integrity, and leadership, and that we'll find solutions to some of the most disparate health issues found in our state. There's clearly more aspects to our budget that I could highlight, but we only have so much time. I want to thank Ann Berry for her leadership in this budget process. Our work is a reflection of her leadership as well. And thank you to Deputy County Manager Dr. Allwood for his vision of a more connected and seamless service team. Thank you for your attention, and I'd be happy to take questions.
Thank you. Commissioner Modis Castillo.
Thank you, Madam Chair. Thank you very much for your work. I always love participating with the Public Health Department and the home visits and just to hear the community, how much that the impact is on their lives and the work you do. So kudos to your entire department and the great work. I do have one question, and it's probably detailed, but I'm looking at the budget, and there's something listed that I've never heard of, and it's called the Ryan White Park B Supplement. Can you tell me what that is?
What's the page number?
Oh, I'm sorry. It's on page 378, kind of at the bottom of the list of expenditures. And then there's also a significant kind of increase from 18 to 19, and that continues through. So can you just tell me what that program is?
Sure, and I'm going to look to some of my experts, but Ryan White funding is in our sexual health clinic and does work on HIV prevention.
Okay.
I'm not seeing the line that you're talking about with.
It's like 7 from the bottom on page 378. It says Ryan White from 66,000 to 103. So,
I'll have to get back to you because
Okay.
it could be a change in just what we got. No, you know what? I think what it reflects is at the time of this printing, since it's a grant, you're not seeing the full dollars in the grant amount. Do you think that would be?
okay, thank you.
Can I just? I know something about this from my previous life, working at the Department of Health. So the Ryan White funds are used to support people who are living with HIV.
Okay.
And
Thank you.
I'm not sure what the dollars are here, or what the numbers mean, but these are dollars that are available to public health departments to help ensure that people who are living with HIV have the care and the services they need to remain healthy.
Great, thank you.
And the reason it went up is simply because, I was trying to understand what you were commenting on as far as not having the full amount. So are you saying that the FY18 is lower?
Madam Chair, I believe it has to do with the grant funding year, and it doesn't line up with
Okay.
what you see here.
We can get more information. Commissioner McGuire.
Thank you, Madam Chair. Thank you, Ms. Adine. It's amazing to hear all the work that public health does, and I know we say often that it's health in all policies, so you're intertwined into everything that the county does, and that is a lot of work. So thank you for all of that. Just want to comment on a couple of things that you have already mentioned in your narrative, and I just want to call it out, that of course the focus on 0 to 3, our prenatal work, and I know in the narrative it says to improve kindergarten readiness, but really I think the work is to really stabilize our children and our families at the earliest age possible, and that this work is done throughout, that this work will hopefully be systematized throughout the whole county. I know it's now being done in our at-home infant visiting program, but we really know that this really impacts all of the work that our county does. So I'm just looking forward to the continued work of that effort and the work that Nancy Lee is doing as our fellow in that program. And thanks to the Pritzker Foundation for helping us get started in that work. But I know it's work that we want to continue. So thank you for calling that out. Love that we're going the whole spectrum from prenatal to 3 to our age-friendly communities. That I asked about it when Ann Berry was up here, Director Berry. and just thankful that you're working on becoming an age-friendly community. We know that all the things that help as we age, help our families throughout their lives. So we need transportation for our families, no matter what age they are. We need recreational opportunities, healthy eating for all of our residents. Which brings me to our active living Ramsey communities. I know you call out in your strong public health integration that you're working on active transportation and walkable communities. And I just want to call out that active living Ramsey communities is part of the public works budget, but I know that that you work in connection with public health to really make sure that we have it integrated into all of our service areas. It's a great example of our cross-service area work. So thank you for that. And just the group violence initiative, one of my very first bills that I carried for Ramsey County when I was in the legislature was "You Are the One Who Can Make the Peace," was a great violence prevention initiative in Ramsey County. We had small grants available to counties to do that great work. And so I know the works of Shirley Pierce and Don Galt were a long time ago, but I know that they're still felt in this community. And just thanks for continuing that work now with the Healing Communities Project, because I know that that's really, really important work. So thank you so much. I also want to say thanks to Zach Hansen and his team for all the work on organics. My communities are really calling out for more work on they've already bought into the whole recycling, and they really want to keep going on organics. And so I just thank them for their work on the waste reduction and specifically organics recycling and what we can do with our communities on that. So just thanks so much. And if you wanted to comment at all on any of your cross-department work that you're doing, I'd welcome that now. But if you want to comment on how you are working in cross-service teams, because I think it's a really great example of the work that we can do between service teams with our active living work.
Absolutely, Madam Chair, Commissioner McGuire. Thank you for calling out all those wonderful things. We have a lot going on, and I wish we could put it all here and say it all here. It's a good thing that active living has been in multiple departments. It means that more staff around the county have an understanding of why it's important to think about our community when creating the next path or the next sidewalk, or deciding on where to develop something and how it aligns with transportation or how it aligns with the built environment. I'm happy that it's in Public Works, and we continue to partner through our statewide health improvement partnership. As you know, Carissa Glatt's been a leader in that area of active transportation. So thank you for calling that out. I appreciate it.
Thank
you. Commissioner Carter.
Thank you. So with the volume of areas of work that you encompass within the public health department, it's hard to know how your staff isn't schizophrenic. I don't know. There's so much to do and so many areas of work, but it's true that at the bottom of everything is our health. And so it's delightful to see how we are integrating from public health into so many areas of our county's work, everything from early childhood to waste reduction, et cetera. But I just wanted to remark, I wrote down, and then I have a couple of questions. I wrote down reflective, responsive, relevant, and transformative as I look at the work that you're doing. And I'd like to mention a few of the areas that illustrate that. I'll start with the first. You talked about the recycling ambassador position, which actually to me does appear to be very responsive to requests that we've had through the years that we've not been able to mobilize to consistently address, to help with waste reduction, with cleanup, with all kinds of efforts that people in our community, really are implementing and need our help with. And so you have reflected and you have determined that this makes sense for all of us and institutionalize the ability to respond and to respond in a coordinated fashion. And I want to say thank you for that. Next would be on page 370, the Healing Streets Project and the collection of work that you're doing there. I have a question about that. You know, clearly this is responsive to a need in the community to address the impact on youth and others who are involved in violence, gun violence in particular, or group violence. And this reminds me of, you know, I'm thankful for all the work you're doing today that you've already talked about. It sure reminds me, though, of our need to respond during the community's response and reaction to the Philando Castile death. And the fact that Ramsey County actually marshaled resources. You know, we looked at ourselves and were able to plant a response, working together with community organizations and churches and others, so that we had an immediate, on the street, available response to help people if they were in mental health crisis or whatever the case may have been. And that was good. It was an immediate response. And soon after that, we were no longer able to consistently respond, and the need still existed, you know, as it does today. So again, thank you for this. I am assuming that this isn't just going to be about a one-off shooting or, you know, about gang violence in a particular area, but that it is in response to whatever the need might be in the community. Do you see a way in which, for example, this might have been a response at that point in time? Should we have had this up and running at that time? Or in which it can be more general and comprehensive today? It's not just a, you know, we see a gun violence incident, we respond immediately, and we're gone. But there's continuity here in terms of its ability to be a connector in the community.
Madam Chair and Commissioner Carter, you know, it was from the first idea of what this was or is to where we are now, it was always a part of, we need to make sure we put this into a levy budget, into a budget that's not reliant on, are we going to get the money next year? Are we going to get the money next year? Because the people might go away if we don't. This is about building relationships and about trusting community and building community and connecting with community and not walking away from community. It's intentional to be investing in the community health responders as people who are of the community and in the community and are relied on for the day-to-day needs and for the incident that happened, you know, at the corner of whatever. It's really important for us to make sure that we are being supportive and are putting an investment in our community so that more and more people feel comfortable in these spaces, and that it's all of our jobs to make sure that we have a healthy community. But it's you know, it's a lot of work, and it's important, and it's an investment, and we don't see it necessarily as only addressing the incidents in the moment, but really building that capacity.
That's exactly what I was hoping. Can I continue? And there are a couple of other things that I'd just like to note and remark about. One is your measure on page 374, and I applaud you for the identification of interns, temporary health employees, as a way of exposing young people and adults in the community and Ramsey County to the assistance of young people and adults, with a focus, of course, on interns of color and who are American Indian. So the measures do focus on the increase in the number of interns. Can you talk a little bit about how you anticipate that will also impact the public health complement?
Thank you for the question, Commissioner. What I talked about in our work to invest in our workforce is getting just at this, is that we need to make sure that what we're being asked to do in the community from a public health lens, that we're able to respond and connect. And that means that we're employing people who are from and of communities. And so there have been many cases where people have come in either as interns or fellows who have found themselves into permanent positions. And so it's really about building the capacity, first building an understanding in community, in schools, at the middle school and up level of what public health is. And then it's investing in interns who don't always have a pathway or a door to our offices, but it's investing in people of color specifically into our department and making sure that they have we help build the skills needed to become a public health professional.
Thank you.
Just a moment. County Manager O'Connor would like to clarify something here.
Madam Chair, Commissioner Carter, I believe, so the strategy is to increase the work experience and the number of staff, but the percentage actually refers to the percentage of total paid public health temporary employees and student interns. And so it's not a year over year. The strategy requires a measurement of the share of staff that fall in that area. I just wanted to clarify that because I think that's an important part of how you get to the strategy and what we're measuring here.
Right. It's still focused on the temporary and intern. Right. Got it. Understand. Thank you very much. I have more, but I am going to release this so that others can comment.
Okay. Commissioner McDonough.
Thank you, Madam Chair. Kathy, it's been called out in the major change sheet and you referenced it, but maybe you could talk a little bit more about the healthcare service transferring 5.3 for correctional health into public health and what that means for the county and the work we're doing there.
Madam Chair and Commissioner McDonough, thank you. Well, as you know, it's been a big shift back to the public health department, and a lot of work. There are a lot of positions that were not filled and needed to be filled. We came to you, as you recall, asking for FTEs to make sure that we have the right complement in our correctional health space. It's been going well. It's great to have Michelle Blanchard in place as our leader of the correctional health division, and she's building a staff and working with the staff that are there to really make sure that we're investing in our community that are in our facilities.
Thank you.
Commissioner Carter, we're back to you.
Oh, thank you. Okay, this is brief, and it probably is not just for you. I'm sure it's not, but it comes up in your budget. I want to recognize that on page 368, at the bottom of the page, you talk about institutionalizing racial equity practices that can change biases and racialized powers that are constructed within government. And on page 370, you refer specifically to the obstacle to employment at Ramsey County. That is the obstacle of criminal justice systems engagement, I believe. That is a barrier. And we know that some time ago, Ramsey County institutionalized the ban the box so that that question about involvement in the justice system comes after a decision to employ. And I would like to ask a general question about that, thanking you for the work that you're doing to deconstruct this, to ensure that that we have the ability to hire those who may have been involved in the justice system based on what the job might be, the qualifications for the job, the issues of involvement. Because that's fair, and it's important, recognizing the disproportionate impact, particularly on people of color, of that engagement, and therefore the disproportionate collateral consequences that are suffered by those communities, which of course leads to lack of housing, lack of employment, low income, and inability to support families. So all of this is fair. I would like to ask a general question about our ability today. And I'm not quite sure how that should come back. I know it's for the countywide team, so we'll probably get back to that again. But since we have banned the box, and we know that we have people who are looking for employment who have been involved in the justice system, how can we observe our ability and success and or inability, lack of success and need to enhance that work? So it's probably a question for county manager and countywide team, but I do want to put it out here at this point in time, congratulating you for the intense work and focus in that area.
County Manager O'Connor.
Madam Chair, Commissioner Carter, and I will say that public health's been a leader in this space in leading into reviewing on a case-by-case basis, past criminal history and record, juxtaposing that next to education and time served, and looking at the skills and expertise you can bring into the organization, and we're seeing direct benefit from that in this budget. On a broader systems level where your question lies, I do think, by the way, the specifics do matter to it, so I highlight public health because I think it matters to where we're going. We have a strategic team budget presentation on, is it Wednesday of this week? On Thursday of this week. I will have us answer that through the lens of HR in a more comprehensive way on Thursday and see if we can start the answer there.
Excellent, thank you.
Commissioner McGuire.
Thank you, Madam Chair. I just want to say thank you to you, Director Hadeen, for being nimble and just taking on these responsibilities. This is the second time that you've become the acting director. We're just thinking of you as the public health director in this capacity, and you have just taken on these responsibilities, and we just really appreciate as the departments are transitioning. You and Ann Berry and Dr. Allwood have been just really great at responding to the needs that the county has. So really appreciate your willingness to take this on and to serve in a great capacity as our director of public health. So thank you for that.
Thank you.
Thank you. All right. Thank you very much. I will, well, first up, what I would like to do is to, as I do at the end of each of the budget hearings, is try to kind of provide a little bit of an overview and what's coming up. And one of the things that seemed very clear is when people are interacting with this team, they are generally in crisis. They are vulnerable. And the stress on our staff is palpable. I mean, it is something that we really need to pay attention to. And I noticed in the community corrections, the secondary trauma program, what a great idea, because there's again, the stress and the trauma is not just to the people we're serving, but also to the people that are providing that service. The families first is right in line with our residents first approach to things. And then also just looking at the measurable outcomes, which is what our budget is about, whether it's in mental health services, health equity work, reducing group and gun violence, the environmental work that's being done. All of it is pretty phenomenal. And we just need to make sure that we're continuing to move upstream in all of those. Again, it's something that really makes a difference in everyone's life. The things that we are going to get more information on are the Ryan White grant, and then also a follow-up on the strategic team, which leads me to what is coming up as far as our next meetings. We are not, since this space is shared, we are not able to be here this afternoon, but we will be in room 220, and that starts at 1 o'clock. Tomorrow we have safety and justice all day, and that starting at 8:30, and that will be in the chambers. Since Tuesday is our normal day in the chambers, we have it all day. On Thursday at 8:30, we will have the team that will be looking, or the strategic team, as County Manager O'Connor talked about. Also the fee report, capital improvement, and the administrative addenda that day, followed by the first public hearing at 10:30 that day. And so I just want to make sure that everyone that's listening understands also that if you have comments, that you can provide those via email, going to the website, to all commissioners at once or individual, or however you want to get that information out there. If you want your comments to be part of the public record, it is best that you put them in writing somehow. But we also obviously would accept or have taken a lot of phone calls and different things that way as well. So again, if you want to look further into the budget and the schedule, it is www.ramseycounty.us/budget. And then finally, I want to end pretty much in the same place I started, and that is, I have quoted Senator Wellstone, and I just want to make sure that everybody understands that I don't do so in a political nature in any way, shape, or form. It's really about practicality. It's about moving things upstream, improving and saving lives, and saving dollars at the same time. We hold ourselves accountable. So the prosperity, opportunity, well-being, and accountability are not just words, it's how we do our budget. So with that, I will quote Senator Wellstone, "We all do better when we all do better." I'll see you at 1 o'clock in room 220.